Very warm good evening to everyone joining us for day 2 of this special webinar of AI for the rural healthcare practitioner. We had a very fantastic discussion on day 1 led by Dr. Avneesh and Dr. Jaideep. Fascinating discussions on what exactly is AI, what are the tools which can be used in day-to-day practice, and more importantly, as doctors and medical professionals, we need to be aware about the ethics and the privacy with the recent regulatory approvals. We had to cap it off a fantastic demonstration of how AI is used in clinical practice by Dr. Vishal and Dr. Rajavardhan. And that brings us to day 2 today. Today is going to be action-packed in a different sense. Today we are going to be showcasing how AI can be used for research and publication, and according to me, with a personal bias, the best invention of mankind in the last 5 years, NotebookLM. We are going to show as to how it can be used, and then a very, very special 45 minutes to 1 hour panel discussion with some of the stalwarts in digital health and AI in the country on how do you pursue AI as a career option being a medico. Without further ado, I would like to request Dr. Mehika, Communications Secretary of the St. John's Medical College Alumni Association and Consultant Dermatologist, to introduce our first speaker of the day.
I would like to warmly welcome Dr. Josephine Priya, who is the Associate Professor and HOD of Community Medicine in Thanjavur Medical College. Dr. Josephine did her MBBS from St. John's belonging to the batch of 2005, followed by her MD in Community Medicine from BMCRI. She is passionate about community medicine and public health and research, and as an AI enthusiast, particularly in its applications in the research sector. Over to you, Dr. Josephine.
Thank you, Mehika. Thank you for those warm words, and good evening to everyone. So I also saw some of yesterday's session, so I think was excellent. So I won't waste much time, and let's just quickly get into what is the use of AI in research? Should we be using it at all? And when we use AI in research, is the research ours or is it AI's? So I'll just quickly just share my screen and we can start. Right. So research, as we know, traditionally we have learned it as the IMRAD model. But with AI coming in, I'm going to take you through 5 steps that I'm naming differently. So let's start with research. The first step is usually when we are overwhelmed, and how do we use AI to get the output? So whenever you have a research question in mind, or you want to conduct a study, you want to start a research process. So the first thing we normally do is we think of Google Scholar or PubMed, okay, and we are typing some things and we get so many papers. So this is the common scenario that happened before AI came in, right? So you have so many tabs open, you're scanning through so many things, and you're fatigued much faster than you really need much more time to go through, to assimilate, to synthesize, and manually it's always been quite a rigorous process. So when you actually want to do the research without using AI, what happens is that it actually feels much harder than it should actually be. It's because we have a vast amount of literature currently, okay? There's so much of information out there, and to do a good research, you need to first understand what is there about our topic out in the world. Okay, and to arrive at that clarity itself can take months, but not if you are using AI. AI is now, it has already changed how research is being done. So if you actually compare, there is an increase in output of more than 300% since AI has come in. Okay, the number of literature being published previously in biomedical journals is now, it has increased dramatically, because the time required for these manual laborious tasks is much lesser now. So before AI, it was manual, time consuming, it was fragmented. Now after AI, you have a very rock solid assistant, your work is structured, and you can move significantly faster. So I told you I'm going to reframe the work process. Okay, I'm not going to say introduction, methodology, results, and discussion, but I'm now going to name it ask, search, synthesize, write, and refine. Now, what happens is with AI, this is the better way to go about your research workflow. You first ask a research question, then you search for papers. Once you have those papers, you need to look at those papers and understand what those papers are saying. That is the synthesized part. Once you have all the information assimilated, okay, you have it categorized, then you need to write up the draft, okay, for your paper which you plan to publish. And it's always it's not just one step. It's not writing the paper, it is writing the draft of the paper, and then you have to rework the draft multiple times. That is called the refining. Here at this step you edit, okay, you correct grammar, you look at language consistency, you look at flow, you need to do all these things. And you, to have a good paper, you definitely cannot have lesser than 3 drafts, okay, and you need to re-edit, okay, and all these steps are made much easier. And at every step we have AI tools that can make this process more refined for us. So I'm just going to quickly take you through all these steps. So the first one I said is ask a question. Now, before, when we had a Google search or a PubMed search, okay, the question, I needed to have a good grasp of keywords, of mesh terms, of Boolean operators, and I needed to just keep playing around. Okay. So if my research topic was something in diabetes and thyroid, I would have different permutation combinations, okay, multiple searches to find papers. Okay. So just to show you, okay, if I just put this question, no, diabetes and thyroid into PubMed, what do I get? Okay, so since we won't have much time to do hands-on, I have just, I've taken the output for some things and I've kept it here. So this is my PubMed page, and you can see here that for this topic, I am having close to 2000 papers. Okay, and then I will do the usual. I'll use my filters and I will, go through, I will sort it based on timeline. I want only last 5 years, 10 years. But even then, the volume of papers is going to be tremendously high. And not every paper is actually going to look at the objectives that I am looking at. So the first step is to use some AI models to improve a research question. Which models can I use? So when you want to improve your research question, large language models perform very well. So what I'm talking about is using ChatGPT or Claude. I personally like Claude very much. It's more technical, does a more, it's like giving a job to a specialist compared to ChatGPT, but ChatGPT is quite good today. And then you can even use Gemini, Copilot. So all these large language models are very good at having conversations. So you can say, I want you to give me a title, this is what I want to do. These are my objectives. This is my target population. So these AI models will help you refine your vague ideas, and it will go from a very broad spectrum topic to something that is more researchable. They don't just stop at that. They can even give you good primary and secondary objectives that are going to satisfy SMART criteria. So if you look here, this is the question I have received after I've put it through ChatGPT or Claude LLM. And what you need to understand is when you use these large language models, the output you get is heavily dependent upon how good your prompting is. So the better your input prompt, the better your output. If you just give it, a small phrase and say, give me a good research question on this topic, the prompt, the question that you get as the output is also going to be a little vague. So always put in effort into your prompting to ensure you have a better quality of output. Step 2, once you have a research question, you need to feed it into something which will find papers for you. Papers that are accurate and papers that are going to answer the question that you are asking. Okay. Instead of finding 2000 papers, I'm happy if it finds me 100 papers and all those 100 are relevant to me. So on my screen, I've given you names of some AI tools. These are all quite easy to use. Okay. So if you really do not want to spend time, okay, trying to master an AI tool, I would suggest you use something called Allen AI. Okay. So it's asta.allen.ai. I'll show you the page. This is easier than performing a Google search. So if you just type your question into Allen AI, it will quickly go and find some papers for you. So I'm just going to show you now. Okay. So what I've done is I use ChatGPT. I improved my research question. I'm taking this question to Allen AI. Okay, and this is what Alan AI looks like. Okay, so don't get very confused with the page. Just see where my cursor is highlighting. This is my research question. Association between TSH levels and HbA1c in type 2 DM patients between 40 to 60 years. So it'll take a few seconds and it quickly gives me an output that you can see on the right panel here. So you can see that it has found 75 papers, right? The beauty of all these AI tools is they give you an option called sorting by relevance. So you can see here, so when I sort my papers by relevance, I have the most important papers, okay, that will be the closest to answering my research question. So if you look here, Alan AI, just a simple prompt and it quickly found studies. And you can see here my cursor is hovering over something called perfectly relevant. When I keep my cursor on it, it is showing me the score is 0.9. So what this tool does is it scores all papers out of 1. Okay, and the Alan AI is completely free. There is no paywall and you can use it how many ever times you want to perform as many number of searches. So when it scores a paper out of 1, okay, perfectly relevant will be the score that very close to 1. Okay, and when you go down, you will come across relevant and somewhat relevant. You will never find irrelevant papers. So if you look here, relevant is 0.9. And it doesn't just stop at that. It's not just telling me this paper is available. It is also giving me some information. What it actually does is it pulls out the answer to my research question. Okay, so when I go down and I say show me evidence for every keyword that was there in my research question, it is giving me the answer. So I said TSH levels, it identified TSH levels as a keyword and it is showing me the part that talks about these values. HbA1c, the sentence is straight from the paper. And age range, okay, 40 to 60, it is showing me it had 250 women in this age group. So what it is actually telling me here is there is no hallucination. When I go and open up the paper, I will find this exact sentence in the paper. The problem with using large language models, now if you ask ChatGPT, okay, let's say you give it the title, you give it the objectives, you even give it the data, it can perfectly write down an entire paper by itself. But is that the right way to go about it? No. Among the many problems that come with that method, one important problem is something called hallucination. So it'll find papers that sound very factually accurate. It sounds like that paper is actually there, but it is not actually there. Okay, so that's what we call AI hallucinations. So it's very difficult to filter this out from real existing papers. And you definitely, if you do happen to use these large language models to find papers, then you must go and ensure that paper actually exists. I would strongly suggest you use these specialized AI tools for finding papers. So this is Alan AI. Now let me say, I spoke to you about first finding papers. Finding papers alone is not enough. Okay. So now I need to synthesize information from the paper, right? So let me say I found 75 papers, but to go through those 75 papers, find the information I want, it is going to take me a few weeks. AI can help me with that. Okay, I just change my prompt. I say, find me studies on the relationship between these two variables in type 2 DM and summarize the key findings. And I'm going to show you this in Elicit AI. Okay, so this is what Elicit AI looks like. Okay, so like I told you, I've already given the input and the output is on the screen so as to save time. But you all can definitely try it out. They're very easy to use. So I just have my prompt here. It did the work. Okay, and if you go down, you will find that it has summarized all the findings. It has even cited the papers. Okay, so it says majority of the studies show that there is a positive correlation between these two in type 2 DM. So like this, among all the papers it finds, it will quickly summarize all the findings for me. It will give me the contrast findings, and on this right side, it will give me the individual papers. Can you see? So here it has summarized 10 papers, the summary of each of these papers, and I can do a lot of things. Okay, I can change the columns, I can ask questions. There is another tool similar to Elicit that is called SciSpace. So I think you should go back and take a look at these tools. Okay, so just to show you, I showed you what Alan AI looks like. I've shown you Elicit. SciSpace is equally similar. Then you have something called Research Rabbit, which will very quickly find a lot of papers for you. right? So all these tools are very easy to use. They're very friendly to people who are new to AI, and use these things to not just find papers, but also to find out what these papers are saying, so that you don't really have to go sit and go through each and every one of those papers. But that does not mean you critically evaluate what the AI output says. So if AI is saying there is a positive correlation, it is our responsibility to ensure that the findings are actually there. So that definitely needs to be done. So ensure that you get study tables which are going to tell you who are the authors, what is the year of publication, what is the sample size, what is the study design, okay, what are the outputs, key findings. You can even ask what are the limitations of the study, and all this output happens in a few minutes as compared to hours or weeks of us doing it manually. So when we are synthesizing literature, if we are doing it manually, we have too many papers. It's very difficult to keep track of what each and every paper is saying. So in those days, we highlighted it. We had little post-it notes. Then we moved to using annotation in PDFs. Now nothing. Okay, have a folder in your system with all your papers of interest. Use these AI tools to get all the information extracted from it. Okay, so I think your next session is on NotebookLM, and it does an excellent job of actually pulling out all the information that you need from these papers that you will actually use when you're writing your paper. And I'll show you how that output looks. Right? So what we will do is I'm going to show you how I have selected 10 papers of interest to my research question, and I have already uploaded it in NotebookLM, and there is an option called data table, okay, which I think you can look at it in your next session. So when I have these papers inputted, okay, I need to have a good detailed prompt telling the AI tool exactly what information you want to pull out. Okay, the objective of this task is to identify recurring patterns, contradictions, what are the research gaps, what are the findings, in who the study was done, all these kind of things that we usually need to put down in our review of literature or in the discussion. So what I'm going to do is I'm just going to quickly show you. So this is what NotebookLM looks like. And here you can see on the left, okay, this tab is sources, right? So in sources, so all these 1A, 1B, 1C, they are all papers that I have downloaded from PubMed or some other source, okay? And they are all related to my topic of interest, okay? And what I do is, once this is uploaded, I select all my sources, and on the right side, I have this option called data table. Okay, and this does an excellent job of actually pulling out all the information I want. So if I click on this, it will allow me to prompt. Okay, so it is giving me an idea. Create a table with major findings from these research papers, like the title, author, key results, group them by topic. But what I do is I use a technique called meta prompting. Okay, so I generate a prompt, okay, specifying every single information I want from all these papers, okay, in a tabular format. And I feed it into ChatGPT or Claude. And I tell Claude, I want this output from NotebookLM. So improve this prompt. Give me a prompt that will give me the best output. So when I use an AI model to improve on my prompt, okay, that is called meta prompting. And the outputs are definitely better. Not all of us can prompt very well. Use AI to improve your prompt itself. Okay. So when I feed that here and I say generate, I get a table like this. Okay. So it will quickly, so you can see this comparative efficacy of, I think I've done diet and exercise. Okay. Lifestyle modifications in non-communicable diseases. I've added 10 papers. So it says 10 sources, and this is what happens. So it gives me a nice table. So the first column I asked for was the title and the author name, the journal, the study objective. Okay, what was the study design? What was the intervention? What was the outcome measure that they have looked at? What are the results? So I want you to take a look at this output. Okay, this is what we used to do manually before, and very often, because the process is so tedious, we lose track of what we are doing. So the effectiveness is not there. But when you use an AI tool, okay, each and every step, your efficiency improves so much. You're finding papers that actually matter to you, and from those papers you're pulling out the exact information that you actually need. Okay, AI does not suffer from human fatigue. So, it can just keep working for you. You just need to know how to get work done. So this, if you look at it, it has summarized all 10 papers, okay, and all the information that I want. So this is what we do when we look at literature review. And once this is done, okay, the next step would be to actually write a paper. No, so it's not sufficient. Of course, in between you do carry out your research and you collect your data and all that, and then after that you go into writing. There are lots of tools available for writing scientific articles. Two very popular tools are PaperPal AI and Jenny AI. Again, I strongly suggest you don't use a large language model to write technical papers. Okay. If I want to draft a literature review, okay, there are some rules to drafting a literature review. You need to have a coherent transition of ideas. Okay, the transition should not be abrupt. One idea should lead to the next. You also need to talk about contrasting ideas, contradicting views from different papers, and so many things. Okay, so when you use a specialized tool that can draft your literature review, it takes care of all this. Okay, so what I'm going to do is I'm going to show you a small demo in PaperPal AI. So this is PaperPal AI. Okay, and it has a specific function for drafting a literature review. Why did I go to NotebookLM? You will see now. Okay, so here I have this write option. When I say write, I get the small thing here which says right at the bottom of my screen, okay, draft a literature review. So I'm saying this is the function I want to execute. Okay, it will not just draft a literature review on any topic. Okay, it is asking me to attach a file. This is why I generated that synthesized document using NotebookLM, and I'm going to upload that document here. Right? So I'm going to upload it here, and you can see my attachment comes on here, and I also need to type my topic here. So let me just give something here. Okay, so, and now when I say enter, what will happen is it will work and it will draft a literature review using only the studies that I have fed it, okay, in my attached file. So what actually happens? So if try it out today, okay, you will see that all these studies that it is talking about here, that it is citing, are only from my attached file. So there's no issue of hallucinating or something wrong being represented, because we have checked and verified whether all the information is correct. So just look. So now the output it generates, okay, is going to be as good as the input you give it. So do you see how it is given subheadings? Okay, it is now also citing studies. Okay, and so there's no issue of plagiarism. Okay, when you are giving credit to the original authors and you're paraphrasing it, there's no issue of plagiarism, there's no issue of hallucination. These papers exist. We have checked whether this information is being correctly represented. So you have evaluated the content that's going in. Now can you just submit it like this? No, I told you right in the beginning, it is always the first draft. It is completely acceptable to use AI to generate drafts, considering that you have given it all the information and it is not just going out and doing what it wants. Okay, now it is our job to work on this output to ensure that you are changing it, refining it, redrafting it, altering things, and doing everything else that's necessary. So this is how, so these tools, so I've just shown you in PaperPal. Jenny also works very similarly. It is partly free and partly paid, but for those of us who are working on one or two studies at a time, the free version is sufficient. What you need to really remember is you are the principal investigator. The AI tool is just your assistant. It is not replacing you. You are supplying all the scientific content which you have vetted. AI is just going to make the language flow better. Okay, it's going to give you that professional tone of writing. Okay, the ideas are actually yours. So if you all have ethical dilemmas of whether this can be done, this should be the answer to your question. So you have given an input, which is the data file. Okay, and you are also telling it that you want the output in the form of a literature review. You need to give good prompts. Okay, so it will not have fabricated content because you are giving the evidence database. After this, like I told you, AI can also be used for refining and editing, specifically for grammar and clarity, for improving flow and readability, and for formatting. So you cannot have some words in capitals and some in small, your punctuation errors, all these things tend to irritate editors. So with AI, all this is taken care of. So your paper is not bouncing back because, even if your ideas are good, your language is poor and it comes back, that will not happen. So, having said all this, you must be aware that AI can hallucinate, okay? It can fabricate plausible sounding citations that actually do not exist. It can incorrectly summarize text. It is, after all, artificial intelligence, not natural. We must not be over dependent on AI, where, without AI, I cannot perform research at all. And all AI generated text, ensure you check it, double check it, and attribute to authors if you're citing and paraphrasing from elsewhere. Always verify the source, go through the original papers, and you are the expert. Domain knowledge must be yours. So the right way to use AI is as an assistant. Okay, be specific in your prompts, verify everything that is done, use AI to enhance your work, not to replace your work or your thinking. So we are basically researchers using AI are mathematicians with calculators. We don't expect the calculator to do everything by itself, right? And the mathematician has not lost importance because the calculator is doing the addition, subtraction, and all other operations. So AI frees up our time to actually, the time that we can donate to science. Okay, so use AI as a good assistant. AI will not replace you. So for all those who have fears of, is my job going to go? No, it's not going to go to AI. It will go to somebody who knows to use AI, because they will have better productivity. Their outputs will be better. So you might eventually land up losing opportunities to people who are able to leverage AI. So I think using AI should be something that, is a nice experience for you, something that, picks at your curiosity, and over time you will also learn that it works very well with you, not alone. So with this, I finish my session. So since we had 20 minutes, I've kind of given you a menu card of what AI is available for research, and I hope it's useful. The best thing to do would be to go back and just kind of see what tools are there and try and start using one tool at a time. Don't try to master a tool, rather try to master a function in a tool. Okay, so like I told you, PaperPal is good for drafting literature reviews, for writing discussions. Okay, some tools are good for pulling out papers. So don't try to learn a tool, try to learn a function of a tool. So with this, I finish my session. Any questions?
Thank you so much, Dr. Josephine. I think it was very well put and very well explained in such a crisp manner, taking through the different stages of writing a paper and, more importantly, doing the literature review. I think that is one part where most of us struggle and get overwhelmed by it, like you rightly said. I think the best way is to actually, to those watching it, is to sort of go back through the video and try to actually write a paper using these tools which Dr. Josephine mentioned. I think there's nothing like actually trying it out rather than the theory aspect. Doesn't matter if you want to send it for publication or not, but I think it's very important to use the tools. One question which comes up is, do you need to declare to journals that you have used AI for content generation? What is the limit when you declare, and does paper acceptance go down if you declare, or are there any such limitations?
Right. So, thank you to the person who asked that question. I think this is one of the most common doubts that people have. Journals now do expect you to declare what you're using AI for. So, like I already told you, you are allowed to use AI for editing, for grammar, for paraphrasing, and a lot of the, journals like Science and Nature, they actually expect you to attach a file with your prompts. So if you are going for submission into standardized journals, Q1 journals, then I strongly suggest that you keep a folder of all the prompts you use and declare it. No, your paper does not lose out on publication because you're using AI. It's very simple. Like I told you, it's like using a calculator. There's nothing more to it. Okay. every step that I showed you, I actually showed you how you do your work. So the critical evaluation, the analysis, the thinking, everything is yours. The PIs, okay? We are just using the AI tool at every step. So we used to use Google Scholar to search for papers before. The same way you can declare PaperPal for writing your rough drafts, okay, and you have to attach the file of the, the synthesized data that you gave. So all this is accepted. It is not an ethical problem at all.
Right. But this was one of the questions which was being debated. Does AI get authorship, or is it just acknowledgement enough?
So there are, so I will suggest that everybody go through IJCME guidelines for publication, not just to answer this question, but for a lot of things, because many people, when you all are starting out research, you do not know that the work you do. Commonly, I see interns, involved in data collection, and they don't know whether they should get authorship or acknowledgement. So all these things are answered. But to answer the question on AI does not get authorship. Absolutely not.
Right. Okay. No, I think fascinating points there. If any of our other panelists want to pitch in, you can raise your hand and we will take in the comments with regard to AI and authorship as such. Right. So I think, Dr. Jaideep would like to come in. Yeah, go ahead.
Yeah, excellent presentation, Dr. Josephine. And just call me old school or whatever, but I think please use AI to supplement and augment what you would do. So if you're able to get good source by going to a library and by opening the textbook, please do that. So use AI more or less to fill in the gaps, till we have that capability where we can with confidence say that this is, so the responsibility is ours to maintain the integrity of the, the, the whole, the paper and the product of research that we're doing. And
Absolutely.
again, sorry, I have to remind you, if you're dealing with patient data, please don't upload it into the chat and do your research and analysis with that. So be careful with data once again. Yeah.
Very true.
Right. Very important point, because the last thing you want is the paper to be retracted because of hallucinations. It did happen even for a frontier paper about 2 years back, made a lot of news over Twitter. Thank you so much once again, Dr. Josephine, for joining and for providing such fantastic, and again, the emphasis will be on trying to generate papers. There's some phenomenal work happening from the folks doing the rural service, and I'm sure it comes. Right, now we are coming to one of the most interesting part and the exciting part which people have been waiting for, which is NotebookLM. All of us as panelists have a lot of bias towards this and are passionate about it. So I would request any panelists to sort of feel free to join in at any point of time to interrupt me or to add on to what I'm saying with regard to NotebookLM. I'll request Mika to sort of pitch in along with what she has prepared as such. So, right, I'm going to take you through the first part of what exactly is NotebookLM. NotebookLM is a phenomenal tool which is by Google. So it's on the Google ecosystem. I'm not being paid to promote NotebookLM. It's just that a lot of us have used it for many things and it has really been impactful. So let me just share the screen. Right, so this is NotebookLM, and as you can see on the top page, it says understand anything. And the most important part of NotebookLM is whatever you do. So you can use it for research, as Dr. Josephine showed. You can use it to generate clinical notes. You can use it to understand papers. You can use it to understand guidelines. You can use it to generate PPTs. Gone are the days when you're spending 30-45 minutes to make a PPT, or even 2-3 hours making a PPT. In 10 minutes, you can get a PPT out. You can use it to create infographics, which can be very useful for patient-related stuff. So you just click try NotebookLM and it opens up. These are all the NotebookLMs which I have sort of done. So let's go step by step, and I'm going to go to a very, very simple example. So now when you come to NotebookLM, I think we'll first start off with creating a new NotebookLM. So when you click on create NotebookLM, this is how it comes. So this is a notebook. Now there are two ways you can approach this. Now you can either search the web, and you can use two options known as fast research or deep research, or you can upload files and the sources yourself. All right. So this is one of the most advantageous thing. Not only files, you can also upload YouTube links. If there is a documentary or if there is an educational class, you can upload it. You can use things in the drive as such. So you can click on upload file. These are some of the infective diseases guidelines which I put. So you can click on all these PDFs and you can upload them, and it comes in the sources here. So remember, Notebook takes whatever you have selected in the sources. Remember one thing, it is the sources. Of course, it is picking up what it, so there's some sort of automation where it picks up something, but you can of course change the title here. You can just label it as infective disease guidelines. Now, even though you have uploaded everything here, you can choose which one you want. All right, you can choose to ask it questions only on dengue management, or you could choose by clicking, or you could ask it on everything. Now, what are the other things which NotebookLM helps in doing? So it can create PPTs, and that's from slide deck. And when you click on it, you put in a prompt. You can generate it in any language. There are many languages: Marathi, Hindi, Kannada, Telugu, Tamil, Malayalam. You can generate the PPT on any language. The same thing with regard to the infographics. And there's a very, very new feature that has come in infographics. You can design it in very pretty much some innovative styles. And again, you can decide on whether you want the infographic to be sort of, very concise. Do you want it to be standard? Do you want it to be detailed? The detailed one, of course, is, as you can see, in the beta testing format. So there can be sometimes errors such as the names of the font coming. Remember, when we say there is no hallucination with NotebookLM, it is more for when it creates text materials, slide decks. But when it does sometimes the video overview or sometimes infographics, there still can be. The audio overview is where it can create a podcast. So suppose, let's say you have uploaded the latest guidelines of diabetes and you want to look at, is Mounjaro or Ozempic good? You upload those papers and you can have a debate. It can be a deep dissection of the papers, or it can just be a brief. We will come to the podcast. We'll explain each and every of these things. This has already been shown by Josephine. This is a data table. You can again place a prompt and ask it to create a table with different studies to be compared. So now I'm going to take the first example, which actually happened on the Rural Bonders group yesterday, which was a question about rabies. This was a question where a person had already received a rabies vaccine and immunoglobulins 5 months back, but now came with another bite. So the rural doctor had a question: should I give all 4 doses with immunoglobulin or only 2 doses of ARV? So what I did was, very quickly, I looked at the guidelines for rabies prophylaxis. So when you click on the source, you can also see the source again. So this is the national guidelines for rabies prophylaxis. And then there is, of course, the WHO guidelines of post-exposure prophylaxis. Now, instead of opening each of these documents and surfing through the pages, I just uploaded these. I clicked both of it and I put the doubt which the doctor had. And then it just gave me the answer. So it said, for a patient who has completed post-exposure prophylaxis 5 months back, the WHO decision tree recommends wound washing and the anti-rabies without immunoglobulin. RIG is not indicated. This is only for patients who have never received prior vaccination or for patients who are immunocompromised. Wound washing, RIG and ARV should be given immediately. And again, because the previous PP was completed more than 3 months ago, the patient does require ARV, but it says shorten the current vaccination. Now, again, this is the advantage of NotebookLM. The source document, it is not able to extract properly as to what is shortened vaccination. So it has done its own web search and has written also that it has done a web search. So this is what it says. While the standard medical practice generally dictates that previously immunized patient receive a 2 booster dose series, this specific detail of giving 2 doses is outside the provided sources. And it is telling us to independently verify. So this is one of, again, the most important feature. You can upload the source documents and ask it a question. And at the same time, if you're asking a question where the answer is not there, it tells that it is not there. And even though it gives you an answer, it is telling you that it is coming from outside the source. All right. Now, of course, in a rural area, most of the times you deal with dengue, TB, and malaria. But how would you be able, now let's say you're starting out, it's the first week, how do you deal with this? So you sort of, upload all the documents here. Now you can also search the web for news sources and you can give it a good prompt, or you can ask Gemini to give you a good prompt and say, give me the latest, what is the dengue latest guidelines across the world. So apart from the PDFs which you would have downloaded and uploaded, it will also search the web, and based on your preference, you can upload it and make it a source. Remember, in NotebookLM, your source is the most important thing. Now, once you have uploaded the sources, again, like I said, I click on only dengue management, and then I gave it a prompt, right? So you can use NotebookLM just as a chat. So I gave it a prompt. You are an expert professor teaching medical doctors serving in rural India. Generate a 30-minute lecture on management of dengue in adults. Focus on triage definitions and use real-world scenarios. And again, generate a section of 5 student-related Q&A. So what this prompt is doing is that apart from giving it in a lecture format, it's also making Notebook think, what are the questions a student may have? What are the misconception and myth busters which are there? So it generates this. It generates the dengue syndrome as a leaky pipe syndrome. It triages what is group A, group B, group C, warning signs. What do warning signs include? And then most importantly, it gives 3 case scenarios. A 25-year-old farmer coming with only 3 days of fever, retroorbital pain and body ache. Management being just supportive care. Group B, moderate dengue, it has simulated, hematocrit has risen, persistent vomiting, it has written about what is the fluid, what is the monitoring which needs to be done, and then again someone coming in shock. And then very nicely it's given mythbusters, platelets are 40,000, should we transfuse platelets immediately? It says prophylactic platelet transfusion is not recommended, only if it is less than 10,000 or if they require more IV fluid is better to flush out the virus. It talks about fluid overload. And then I've asked for it a ready reckoner and what are the doubts a student can have. So this way in 20 minutes, you're able to finish, or even less than that, in 10 minutes, you're able to finish everything. For example, if you want in detail, you can write discuss fluid resuscitation algorithms, and it gives it what is the algorithm for group B and group C. Now you may think, oh my gosh, this is all so much. Still, I want it in a clearer format. And that's when you click on infographic. Mika will talk about it in detail, and you say, give me a ready reckoner to display in my OPD on dengue in a management of dengue in a rural setup, right? And let's try it in Hindi, right? Let's make it scientific and ask it to generate. Now it will take some time to generate, of course. but I've already generated it, and there is a dengue clinical management protocol which comes as an infographic. What is the initial screen? What are the warning signs? How do you classify? This is very, very important because most patients come with an anxiety of the low platelet count. How do you manage it by group, and how not to use? So very simple thing which you can display in your OPD so that any new doctor or a junior doctor coming or a patient will also be able to see it. Now, again, what is the other advantage of NotebookLM is that I can look at drug-resistant TB. This is the National Management Guidelines on the drug-resistant TB as such. Extensive document. Now, how do I ask a referral doctor or tell a referral doctor, or if someone calls me, how do I quickly tell about TB management? All right. So you can just quickly select the source as drug-resistant TB, and again ask it to generate an infographic. You give it a prompt. The prompt that I had given was detailed clinical management algorithm for TB. And this is the concise version. Now in infographic, you have something concise version and you have everything. It takes possibly about 10 minutes. What is the shorter oral MDR regimen? What is the longer oral MDR regimen? What do you need to monitor? Generates in 5 minutes as such. What are the drugs used? What is the dosage as such? So infographics is definitely one of the most important aspects of NotebookLM. Now remember, I have generated this lecture. What is generated as a content itself can be saved as a note, and you can ask it to generate a podcast on what it is generated. Very similar to the meta prompting which Dr. Avneesh spoke about yesterday. So you come here and you say, so it has generated this entire lecture because you gave the prompt as generate the entire lecture. And then when you sort of come down, there's an option here called save to note. So this will get generated as a note. Now this note itself can become a source. So when you convert this to a source, it again gets displayed here. Now you can make a podcast of this source. So you click on it, you go to an audio overview and say, I am a rural doctor serving in rural area. Based on this lecture of dengue management, generate an interesting podcast. And now it couldn't be brief. You can make it like a debate, or it can be a deep dive, and you click on generate. Just let me know if my audio is visible. I've generated this in Kannada. If someone, are you able to hear the audio? George, you can just message me. This, of course, in English. Are you able to hear the audio? All right. Is there any way we can sort of make it hear the audio? All right, I think you will be doing the podcast. All right, so Mika will be doing the podcast. So she will share the audio as such again with it. We will get there again as such. Yeah. All right. Yeah, so Mika is going to take in detail with regard to the podcast, but this is just a snippet on how a podcast can be generated even in Kannada about a chat which it has generated.
ಮತ್ತೆ ಈ ಚರ್ಚೆ ಈಗ
ಕಾರಣ
ಹೌದು ಅಕ್ಷರಶಃ ಅದೇ ಆಗ್ತಿರೋದು.
ಈಗ ಆ ಪೈಪ್ನಿಂದ ನೀರು ಮಾತ್ರ ಹೊರಗೆ ಹೋದ್ರೆ ಪೈಪ್ನೊಳಗೆ ಉಳಿಯುವ ದ್ರವ ಮಂದವಾಗುತ್ತೆ ಅಲ್ವಾ?
Right. So now most of you are doing NEET PG. So how can you use NotebookLM to the best advantage? So one thing is, even your handwritten notes can be used for NotebookLM. So I would like to thank the batch of 2019, George, who along with his friends, Dr. Nirjam has shared certain notes. So these are the dermatology notes which have been generated. So it talks about blisters, it talks about, if you can see, papillosquamous disorders, everything. Now you can just upload all of this as a PDF and ask it questions. All right. So one thing which I had asked it was generate from the handwritten notes the differentials for hypopigmented lesions. So there's no sitting and typing right now. You can make handwritten notes, upload it to NotebookLM. As you can see, these dermatology notes which have been written, and then you can ask it questions and it does a wonderful job. So I asked it to explain the differentials for hypopigmented lesions, and it divides them into face, trunk, and what are the differential lesions. I asked it to make it into a flow chart. But now when you're preparing for NEET PG and you're in a hurry, you want something quick. You want to test your knowledge. Very, very simple. You have the option called quiz. So here I gave it an option called create a quiz. You can see the custom prompt, create a quiz and test me on distribution of lesion, patterns, individual use, test used, and treatment. And just based on the handwritten notes, it has generated almost 30 questions, right? And these were not just dermatology based questions. As you can see, one of the other students from 2019 batch sent from surgical gastroenterology. So which clinical sign is associated with advanced gastric cancer and presents as a left supraclavicular lymph node? You're able to also rate it, and you can ask it to explain. So you can ask the NotebookLM to explain your own note based on what you do in the quiz. When diagnosing bipolar disorder, what is the minimum duration of symptoms required to classify as hypomania? What form of leprosy is characterized by well-defined borders? Everything being generated as a quiz just from handwritten notes which you have uploaded. Who would have thought such an era would have come? So there are some WhatsApp notes about psychiatry, and what is remarkable is doesn't really look for good handwriting or clean handwriting. As long as it is comprehensible, as long as it is desirable, it will take it. And it has clearly divided both the psychiatry, surgical onco, and psychiatry. So this was the prompt I gave it. I want you to make a quiz of 20 questions from these notes, focusing on distribution of lesions, patterns, and treatment. So for NEET PG, this is a fantastic tool from your notes. Now, let's say you have some, this was shared by George. George, thank you so much. Pathology. Let's say there is a pathology source which you have on your talking about cell injury, right? Now, you can go to reports. It can create a short study guide. It can create a blog post. It can be a briefing doc. On the other hand, you can write that create a high yield notes for this, right? So you can click something on as a study guide and give it a prompt. You can write you're a highly capable pathology teacher. Give me 10 high yield points for an entrance exam from this source. And it will create a study guide for you. Most important, apart from a quiz, if you just want to revise an entire chapter, you can just upload the PDF and go to something called as flashcards. Now, flashcards are one of the most comprehensive aspect. It has generated 84 flashcards based on just one chapter. If you were to be thorough in this flashcard, you're going to ace the subject. So fibrinoid necrosis in blood vessel is seen in which vasculitis? Polyarthritis nodosa. What is the clinical term for coagulative necrosis affecting the extremities? Dry gangrene. Zenker's degeneration is seen where? So on and so forth. So the entire PDF conceptualized in a flashcard, 84 flashcards. You possibly take 15-20 minutes to finish the entire thing. So a very, very good tool for revision. And again, because it is sticking itself just to the source, you're not going to have hallucination. So we have finished infographics. We have sort of finished flashcards. The other most important is, especially if you're writing a long essay or a long answer, or to crystallize your thoughts, it can also generate a mind map to sort of divide into it. If you want to make learning interesting and friendly, I've uploaded Harrison's Hematology. Now, again, we have to be very, very careful here. This is a Harrison, of course, which I've paid for. But can you upload copyright content onto NotebookLM even for personal use? We still do not know. So NotebookLM is very, very good for generating PPTs. If I sort of look at the infective disease guidelines, let's say I want to learn about malaria 2025 guidelines. Click malaria 2025 guidelines, go to slide deck, and right there again, generate a ready Reckner slide deck on the latest malaria guidelines for medical students. You can do it in whatever form you want. I will show you how you can tweak. Now, this is just a professional slide deck, and within 10 minutes, it sort of generates this. I hope this is visible. It gives you sort of a summary, and you can see clinicians, medical officer, program managers. What are the definitions of high transmission, moderate transmission, low transmission? What is uncomplicated malaria? What is the treatment guidelines for it? How do you recognize severe malaria? What is the radical cure? Checking for G6PD. What are the medicines you use? So 15 slides generated. Now, previously, this you cannot edit it, but now you can, of course, edit it by clicking on this option called revise, and you can make changes and then ask it to regenerate. Now, if you don't want it to be boring and you want it to be little interesting and exciting, one of the most important things in hematology is how do you differentiate between iron deficiency anemia and anemia of inflammation. So one way to put it is, you can say, generate a quiz, you answer, and you ask it to explain again as a chat, and it generates a nice table of how do you differentiate with various parameters. All right. The other way to understand it is you go to slide deck, you say, create a slide deck in Avengers style retro comic, or you can talk about Durandar style, and help me understand the difference between IDA and anemia of chronic disease. All right. Again, take some time, but generates a very, very creative. So it calls age of anemia the microcytic wars, the vault as ferritin because it stores iron. What are the power levels? The spark, which is the serum iron, the muzzle, the iron thief, we're explaining the loss of iron and how it is iron deficiency anemia. And then if it is inflammation leading to anemia of chronic disease, what exactly happens? So in a nice comic format, it generates very interesting. You will not get bored. Very useful also. It generates. And again, you can keep giving tweaks and changing it. So the last thing is coming to NEET PG. Can you use it for strategy? So again, I'm not sure the accuracy of these question papers which were floating around, but you can upload all the question papers and then give it a prompt. What patterns exist in how the NEET PG exam is conducted, and provide an analysis on which subject has the most question. Now you can also use it in the form of a data table, and it tells you in these 10 years, how many questions have come in pharmacology, what are the most frequent topics, key subtopics identified, and what are the clinical associations. And it also mentions which source document in the file has it used. So from anatomy, there are 554 questions, biochemistry 496, so on and so forth, right? So you can use this to make your own strategy to understand it. So the prompt I gave for this was create a table which lists what are the subjects from which most questions have come. Then in each subject, which concepts or topic have been asked the most. All right. I again thank George for this. So George has been doing this. So I then give it a very specific prompt. You're starting to study pathology. So then it ask it, help me create a detailed list of topics from pathology year by year. Also help me find questions that have concepts from pathology. So in 2012, cell injury and inflammation, hemodynamics, renal pathology. So from every year, it tells you which questions have come from pathology, which again will help you strategize and learn faster, and you can run in detail. So I think I'll hand over to Mika now to take over with regard to the podcast. We have sort of covered infographics, we have covered mind map, we have covered quiz and flashcards. Mika, over to you for podcasts. Yeah, you can go ahead.
Yeah. One second. I'm unable to share my screen. Just one sec. Is it visible? Yeah. So what I have done now. Yeah. So what I have done now is I have uploaded certain guidelines for TENIA. So the common problem that we see in dermatology and rural practice would be possibly steroid modified TENIA. And so if we want to explain to people why they shouldn't use a steroid combo, then we would probably need to create more patient awareness. And this can be done in multiple languages using the audio overview mode. So Nitin has already shown us how to go into audio overview mode, and I have uploaded resources. So first is the Indian guidelines for recalcitrant tinea, which is the ITAT guidelines. And then one thing that you can do is you can upload sections of certain textbooks instead of the entire textbook if you have a limit on the amount of data. So the easiest way to do this is to find the starting page of TENIA in a Dermat textbook and the last page of TENIA, click Save to PDF and upload that portion. So this gets around the amount of data that you have to upload. So if I had to upload entire Rooks, that would be 6 volumes. And it would be a lot of data. So once I've done that, you can see here, I have created this podcast. Now, podcast has an interactive mode where you can stop and ask it questions. So some of us tend to be audio learners, some of us tend to be visual learners. The infographics are very good for visual learners as well as for creating data for patients. But those of us are audio learners, this tends to be better.
Normal looks like. We need the baseline.
Right, the baseline.
So looking at the
So
stat
I'm
pro
going to
right
start at the
now,
beginning.
in millions of bathroom cabinets around the world, there sits a perfectly harmless looking tube of anti-itch cream. I mean, you probably have one.
Yeah, almost everyone has something like that lying around.
Exactly. You get a red itchy spot, you go to the
So they are starting to talk about the different types of anti-itch creams, and in this
normal looks like.
steroids.
We need the baseline.
Right, the baseline.
So looking at
You
this,
can actually interrupt them by putting it into interactive mode. So if you put it into interactive mode and you play audio, you can
right
join.
now, oh, hey, welcome. What's up?
Can you tell me how steroid creams cause drug-resistant tinea? So it's taking a little bit of time.
Oh, hey there. What's up?
Can you tell me how to manage drug-resistant tinea? Can you tell me how drug-resistant tinea is managed?
Oh, back to our listener. What's up?
Can you tell me how to manage drug-resistant tinea?
That is a great question.
Yeah, let's unpack this idea of resistance and management right now.
When we talk about resistant dermatophytosis, it's defined as failing to eliminate the infection.
Even after a patient has been given adequate doses and duration of antifungal agents.
And this failure is often due.
Oh, yeah, let's hear it.
What is the correct dose of itraconazole in a patient who has previously received terbinafine?
That is a very
Oh, go for it.
In a patient who has previously received terbinafine, what is the exact dose of itraconazole?
That's a great follow-up question, tying the earlier discussion about resistance directly to the practical dosage.
Yes, and we heard you ask about the exact dose of itraconazole specifically.
Okay, let's unpack the itraconazole dose for resistant cases.
While the standard dose for a simple TUNI infection like glabrous kinea is often 100 milligrams once daily for 15 days.
Or maybe 200 milligrams daily for just 1 week, the situation changes dramatically with resistance.
For resistant or recalcitrant cases, the expert consensus suggests individualizing the duration based on clinical response.
And sometimes, in those tough cases, the dose can be 200 milligrams twice daily.
But here's the crucial warning that the experts emphasize. We must be extremely cautious about increasing the dosage too high.
Specifically, the experts agreed on not using unapproved higher dose formulations of itraconazole.
This is because itraconazole follows nonlinear
So as you can see, you can have these interactive discussions with the audio, and this is kind of useful if you're, say, stuck in Bangalore traffic for a long time and you want to finish an entire conversation, or you tend to be the kind of person who's not awake at 8 a.m. and you want to listen to the lecture at 11, 12, 1 in the morning, which is how I used to learn when none of the faculty are available to take the class for you. So this podcast mode is really useful for that. You can also generate the podcast to educate patients, and they can interact with it if you generate it in multiple different languages. So I'll also share with you the kind of prompts you can create to generate these things. So you can ask Gemini to create the prompt. And just let me share the screen. Is Gemini visible? Just a sec. So you can see here, you can ask it to create a prompt to create a detailed podcast on dermatophytosis and the effect of steroid on drug resistance. So it will generate the prompt for you. And similarly, like if you're creating infographics, it will generate the prompt, and you can just copy paste this prompt into NotebookLM so that you are not stuck with generating an entire prompt. So I think this is just a basic introduction. I suggest that you play around with it, especially with infographics and audio. If you tweak it, you can actually tweak how you want them to talk. You can make it more precise. You can also tweak the character and personality. So over to you, Nitin.
Right. Fantastic, Meek. I think we all have used NotebookLM. I would like to thank sort of Dr. Sridhar for the last 2-3 months. He was the one who sort of passionately encouraged me also to experiment with NotebookLM. And like you said, we have been experimenting with it. Sometime even midnight, he sends me a prompt and says, I tried this out. Very, very passionate and this thing. So we got some questions here, Dr. Sridhar. One of the questions is, free version, paid version, what's your view on that? Is it worth investing in the paid version?
Can you hear me?
Yeah.
It is always better to pay for any AI tool. No doubt about that. Why? Because you're getting the best AI model. It is the brain behind all the work, right? You want the best brain. Then you'll get the latest and greatest features. My NotebookLM, which is a paid one, will be at least slightly, if not more, better than what you have in the free version. Okay. And of course, they'll also take care of security much better than your other models. I mean, your other free tools. So I would always suggest that if not permanently, at least for a few months, these are subscriptions. So try it out for a month or two. As you're preparing for NEET, right? The neatest job you can do is pay for something and work on it. A lot of people are paying, coaching institutes and all that. You got a better coach here. Pay $300, right? So there was never a better moment to get a paid tool for so less amount.
George, if you can come in here. Just you're doing the rural service and at the same time preparing for NEET. How have you used NotebookLM for preparing for NEET PG?
Like the notebook you shared earlier, one of the main things I use NotebookLM for is just to structure the way I approach a subject. Because, along with work, it's kind of difficult to, dedicate 6-7 hours a day to read a particular subject over a week, and it gets very tedious. So using NotebookLM and, using the previous year's question papers, I sort of create like a hierarchical previous year topic list. So I know which topics require more time, which topics require more of my attention, and like which topics I can keep for later when I have, more free time on my hands. That is one way. And the other way is reviewing like tests that I take. So if I take a test that is 200 questions, like NEET PG is, it becomes very time consuming to review every question, and even just the questions you get wrong, because it's not just about looking at which, why you got the answer wrong. You also have to see why the other options were present in the question in the first place, because the examiner often gives you at least 2 or 3 options that are similar in order to trick you into thinking that this might be the right answer. So there are some prompts that I use in order to help. I mean, it's mostly with ChatGPT or Gemini, that where I upload the question along with the options and I tell it, this is the question, pretend you don't know the right answer.
So till now we were talking about using NotebookLM to generate questions, the quiz and the flashcard. I think you brought a very interesting point, uploading the questions and asking it to explain to you the answer and why the other options are there, to look at it from an examiner's point of view.
So the other thing is not just explaining the answer. So let's say you have a main source, like for example, you're using your handwritten notes as a source when you're preparing for that particular test, like let's say the pathology notes. If you're using that to prepare for that test and you get a question in the test that wasn't part of your notes, you can also ask NotebookLM to, find out what topics were missed in your notes that were asked in the question paper, and generate like a short brief on those particular topics. So you sort of just cover up those topics without having to go back to a larger source and read through it and spend more and more time.
Fantastic. Dr. Avneesh, coming to you here. What has your experience been with NotebookLM? How do you think that doctors should be using it apart from students?
So, I have a word for NotebookLM, which is not a word or phrase, which is Swiss Army knife of all AI tools. So whether you want to make a PPT, whether you want to make a podcast, whether you want to make a mind map, whether you want to delve into your own documents, and the best thing is that the hallucination part is very less, because you are already putting your document. And another feature which they've added, which is deep research, which you showed, I think that is a game changer. So from last 4 or 5 months, before that I used to be a ChatGPT loyalist, but now I have gradually started shifting to Gemini and NotebookLM ecosystem. So that is the change that NotebookLM has brought.
I think yesterday we asked Dr. Jaideep and you if there was one thing which you want institutes to pay for, what it should be, and you said it should be the Google ecosystem. I think Dr. Sridhar said that the Google One AI Premium is $399 per month. George mentioned that it is possibly free for students, and with it you get Gemini access, you get advanced usage for NotebookLM. I will just come to Dr. Jaideep here for the sort of the devil's advocate, so to speak, and to get his contrarian view. Do you think it is sort of okay from sort of copyright to upload textbooks and learn from it? Is it okay to make educational videos and put it out on social media infographics using these educational textbooks when we are uploading it on NotebookLM?
Okay, that's a very difficult question. So, okay, we do it, right? So we do LibGen, we do SciHub. It's
For all
illegal.
practical purposes, we don't. Official purposes, we don't.
Yeah, we are live. We are on YouTube and we are on LinkedIn. We, as in, like, people do it, right? So I'm not saying you and I.
Yeah.
So let's retract that statement. So, but let's honestly face the truth, right? So we do have access to. I think all medical students in India do have access to all textbooks. You have graciously shown a legitimate copy of Harrison's. I don't know how many people can really afford that, but do students have copies of Harrison in PDF? Yes. Let's not deny, what's happening in the world, and then, do we use it, right? So, what's the other alternative? My question would be, what's the other alternative, right?
So I think
And
sort of the consensus is, if you're not using it for commercial purposes and not really trying to make money out of it, I think it should be fine. Mika, you had a point there on it? Yeah.
I think even if we are generating content on our own for patient education, we do use these resources. It's not like we talk off the top of our head when we're telling a patient, say, what do you do to prevent dengue? It's not something that will come up from the top of our head. We are going to be referencing those things. So I think you can cite them at the end or wherever you're posting it. That would be a way around it. Secondly, if you are having these resources, there are ways to get them ethically. Like if you want a legit copy of Harrison's or this thing, there are resources. If funders or other people want to reach out, please reach out. We can get you legit copies of these books.
Right, right. Okay, so let's get to the next part of the talk today, and that is the interesting part. As a doctor, do I foresee a career in AI? For many years, we are talking of doing MD, MS, and all of us here are post-graduation specialty. But honest question, we will start to make just a show of hands. 20 years back or 10 years back, depending on the age group you are in, if there was a AI-based course, would you have still gone with the PG that or the specialization that you did, or would you have gone for AI? How many of you would raise your hands for that? The panelists, yeah? I'm asking the panelists, yeah? Dr. Jaideep, Dr. Sridhar, Dr. Avneesh. Mika is sticking to be a dermatologist. I mean, I like being an oncologist. Yeah, my hand will be somewhere here.
Nitin, I started 20 years ago, so my question is not valid for me.
Yeah, so I'm actually going to come that's a very good point, Dr. Sridhar. You've been someone who used to teach doctors coding during COVID time, from what I hear. Can you just briefly share your journey? You're a pediatrician, but you're sort of moved completely into the digital health space much before it even became the buzzword, like you rightly said, more than a decade back. What drew you to it, and what has your journey been so far, moving away from hardcore clinical medicine?
Right, so let me share my screen and present and talk. And thanks for giving me the platform. So am I on the stage now?
Yeah, the stage is all yours. Let's say.
So as you said, everything goes through NotebookLM nowadays. So I'm also doing that parallelly. And you said present something about your life. The first thing I thought about is NotebookLM. So here goes. I'll share my screen. Just a moment. Maybe I'll share the notebook LM itself. Yeah. Are you able to see my notebook?
Yeah.
So yeah, it has given me a brilliant title, From Anatomy to Algorithms. Yeah. So I completed my MBBS roughly around 98, and then same struggle with PG and getting into the right branch and all that. And then I did my MBBS through the national entrance. I did it at Nagpur Government Medical College. Then I went into diploma in child health from Safdarjung Hospital, Delhi. And then I went to the UK to pursue my MRCPCH. I completed my part 1. For part 2, jobs were NA over there. So I came back. When I came back, I thought enough of this. I'm going to try something else now that I'm back. So at that point, by the time I had seen a bit of the internet, had just started to come in and people were using it. And I had also started using it. So then I decided, why don't we try to apply technology to healthcare? Just like Madame Curie has applied physics to healthcare and everybody's queuing up for radiology these days. Similarly, I said if we can use technology, we would probably in future see something like a branch in medical field. Luckily, to my surprise, there were already branches in the US. I mean, there were courses going on, and it seems they were working almost from 1960 or even earlier, God knows, in this field, trying to apply technology for medical purposes. That is information technology. So curiosity peaked further, and wherever I would work as a pediatrician, I would always go to the small tech department that the hospitals had in those days and discuss with people. And what fascinated me most was with the advent of the internet, that from sitting in your room, you could impact so many people. We talk about public health all the time, and what could be more public than the internet, right? If you could create some intervention or do something and impact so many people. So that was fascinating. So while my journey as a pediatrician was going on, I had worked in various hospitals in the early days of Rainbow Children's Hospital. I was there. In Delhi, I was there in Sitaram Bhartiya. Both these places I was as a registrar. So then I moved to a very interesting company when I wanted to first step into the healthcare IT field. One of our earlier speakers was talking about research and all that. So I moved into a company called Elsevier, the company which produces your Robbins Pathology and Lancet and so many other scientific journals. So I had a post of an editor over there. But my real intent was to see if I could do some tech work. Unfortunately, at that time, they didn't have much of tech. So then I decided to come to Bangalore, and that's where I am now since the last probably 20 odd years. So my very first work was in a company where I worked on a product for e-prescribing. It was on the internet. You have to create a prescription. So I gave the workflows for that and told them how doctors think and what should be the first screen, what should happen next, and the whole flow, so that a doctor could just put the diagnosis, select the medications, and if there's any mismatch or any error, contraindication and all that, the software would flag that. So it was an intelligent software. And then you could, it will also show you the review articles as to why it is flagging that. And then you could prescribe the medications also. And in the US, because the drugs are covered by insurance, so the doctors may not remember every trade name and which insurance of the patient is covering which drug and all that. So it would even show those, that okay, this person is having Blue Cross, so you prescribe Crocin. Somebody else is from some other insurance, so he can get Metacin, like that. And then finally it would via e-fax send the whole prescription to the chemist. So the advantage for the patient is, even if he was visiting from, let us say, from Washington to New York to the doctor would prescribe, and when he goes back to Washington, the chemist would have his meds ready for him. And a very legible prescription. Biggest problem at that point of time, and even probably today, is that handwriting can cause problems. So that was my very first project which I worked on with a US based company. And unbeknownst to me, this company had tie-ups with Google, Dell and all of that, and the entire product was launched free of cost for all doctors across the US, and it was quite a success at that point of time. So that's how my journey started. And then I worked on various other things like EMR and EMR and EMR is electronic medical records. Then I worked on a kiosk for patients in the reception where, so in the US, you have to go and tell about your insurance, whether it has changed or not and all that. So the patient could go, and every time, why does the receptionist have to talk? Why do you have to go to the reception? Because 90% it will be the same insurance. So for that, we created a touchscreen kiosk where you can just go and confirm that, yeah, it's all the same and all that. And in case any difference, then you can go to the receptionist. So various such healthcare projects I did. And then I moved to another company where I worked for pharmacovigilance. So pharmacovigilance, as you know, is drug safety. So there are a lot of processes around drug safety. So I worked on those processes and for almost for 8 odd years. And all that time, I learned all sorts of software processes. So I was had the job role of what is called a product manager. A product manager is like the director of the movie. So you yourself, you have to give the vision for the product, to tell what exactly the product should have, what the customers are seeking, and work with various teams. You have a database team, you have a UX team, you have developers, you have technical writers, you have sales, marketing. Work with all those teams to make the product a success. And then after all that journey, in around 2018, I decided to become a EdTech founder myself. My intention was to make something related to education. So I launched a startup and currently I am working for that. Okay, so I'll take pause here in case you have anything to discuss. So this is my background academically, as I've already discussed this. So all this helped around. And did I learn a bit of tech? Yes, I did do a few courses. And I also did a postgraduate diploma in IT. And I worked as I said, in LC, where I worked in certain things. So all that helped me with my work. But it's been a long journey and a lot of things, a lot of tinkering around, a lot of curiosity that's helped me a lot. So, yeah, any questions around this or anything you want to discuss, or I can go on talking? So this is showing my journey in one of the companies from a product specialist to that kiosk management. And I also was part of a QA or QC teams. It's again a very important because you learn so much about quality control of software. So that is another role which I did. And then defining requirements of software, conceptualizing the user interface, again quality testing of all these, and then various software that we created. So I've gone through various job roles, and which also gives me a good overview of software. So, and then in this company where I did pharmacovigilance, I was a product manager, managing inbound case submissions of adverse events. And then we also developed an in-house quick software development platform, rapid application development. It's like a modular kitchen, right? You already have the modules ready and you just tell what exactly should be the software workflow and it will create. Okay, and I was there in the early days of where what was machine learning, which later nowadays has evolved into full Gen AI and all that. When machine learning came in, we were implementing that as well. So I was working with software architects, trying to build our own internal rapid application development framework. Okay, so various phases of the journey. So this is about the pharmacovigilance ecosystem and rapid application development. And one of the tools I was very much hands-on was called SharePoint. And many of you can try this as well. So you all heard of vibe coding, where you write a prompt in an AI tool and it will rapidly generate a software for you. Microsoft had a tool for a long time called SharePoint. It's still there. So what you do is it's again, as I said, it's like a modular kitchen. You just need to figure out your solution. Suppose you want to build something for the hospital. So you need to just figure out, is it a task? Is it a calendar appointment? What exactly are you building? So if you're doing something, it's a task. So take a ready-made task list and just modify it and the doing part comes in. If you want appointments, you've got a calendar, just tweak it a bit and that comes in. So I used to make a lot of solutions, including solutions within software companies using this SharePoint. I would develop it rapidly. So I've made a carpooling solution, I made a quality control solution, so many solutions, and audit tracking as it's written over here. right? Requirements management
Dr.
solution.
Sridhar, if I could just interrupt you here for an interesting point.
Yeah.
What were your reflections that as a doctor, did you miss the clinical aspect of it? Or were you like, no, I am passionate about tech and I may be using this tech in other spheres, be it for developing, like you said, a carpooling software or solutions for software company? Because this is the point that some of the doctors who are looking at career in tech and AI is asking. What is your mindset as a doctor being away from clinical practice? Did you ever regret at that point of time?
There were, I mean, off and on, it even comes to today also. It's not that it doesn't come. But see, you have to see your responsibility, where is it taking you, and your key tenets. I am a tinkerer. Given a chance, even in the hospital, I would be trying to figure out how do I tweak this some device or do something different. So that spirit remained, and somewhere I have been in touch with something healthcare related.
Okay.
Right. So when I made a e-prescribing solution and so many doctors were praising it, and it gave me satisfaction. Today, when I have a children solution for autistic children and the special needs students, and when mother praises, I feel like my pediatrician inside me is still there.
So more looking at the impact it creates, and if it comes in the field of healthcare. So I think it's a very important point that the young ones who are looking at AI as a career, it's important you understand yourself as a personality and what you're going to be satisfied with.
Yeah, and some people can ride both horses as well. There are people who do that. For me, it was that I can focus only on I decided to get fully into this.
Right.
So
right.
there's no right or wrong. If it works for you and it keeps you happy, that's what is most important.
Right.
Okay, so let me see if I have anything else to show here. Yeah, so this clinical knowledge with all this technical background and then understanding the enterprise product strategies and all these put together helped me build my company called EdQueries, which is focusing on the special needs students. How do I create an online software? My EdQueries software is basically for the special needs students. How do I educate them? Not only the regular academics, but also things like, are you able to see? Let me see this. This is EdQueries. Okay. So what you're seeing is they need to learn about not only academics, but also vocational courses. So if you have an IQ challenge, or if you have a autism where you could have a different kind of mindset, if you're not going for full kind of a university course, some of them do go, but early on if you want to catch vocational, so those vocational courses are also we're doing. So making it simple and fun. How do I teach money to a child who is having difficulty learning? And that difficulty could be anything, right? So how do I ensure that they learn concepts about money? So as you know, in our academics is always more focused on by rote learning, and it's always boring. So here we have gone from what is called, this is called an errorless game. I deliberately call it a game. So you have to click on this 1 rupee and you're done. More complex, higher level, slightly higher, I mean, is suppose I want to teach them how do you do pay money and how do you get back money. And so there is here is a game. I call it a game because children hate the word worksheets, like we all hate. And maybe in medical field also, if we had this kind of thing, we would have enjoyed more. I make this kind of interactive content.
The cat, the items.
Children like to touch and feel and move things around. They feel this is a video game. Same thing in a book would be a word problem. Right? You went to a shop and you paid this much, how much you that kind of boring text. Whereas here they feel it's a video game. They come and touch, and there have been instances where children just scratch the mouse
for 12 rupees and a ball
to
for
drag this.
7 rupees. Good job. You got a ribbon, and
if you make a mistake, it will teach you. So we make this kind of interactive content. It could be a treasure hunt. It could be so many other
for
things.
7 rupees
Simulate
and
a
an
real
eraser
world,
for 2
all
rupees.
that kind of thing we do. So the courses around all these things, life skills, right, cognition related, so many things, and we go on creating content based on demand. This is what I do on a daily basis. Now we are also working with AI related generated content. We use a lot of that, and we had also done AI for a chatbot which is related to only this content, and I presented a paper about that. So this will tell you, if you are the logged in user, how many competencies you have covered, what you should do next and all that. This chatbot will only work on that. It has been explicitly told Sorry, I'm not shared this. Yeah. This is a chatbot we have developed using AI. So it is telling the user what competencies they have covered, what is the learning plan they should have, what courses are available, and all that. So we actually presented a paper about this.
That's fantastic. I think it's
So
very gratifying to see that, like I said, even before the words AI, health tech, digital health became the buzzword, you have been passionately pursuing it across various sectors, truly. We'll come back to you shortly to get your views on some of the questions which have come in from the rural doctors and the young doctors who are sort of seeing this with regard to how to pursue it as such. I would now like to invite on stage Dr. Avneesh. Avneesh sort of put a very interesting chat box message that when Dr. Sridhar finished his MBBS, he was in 4th standard. But Dr. Avneesh, you have been passionately spearheading through various forums, AI in particular, being an educator and an AI enthusiast and AI learner. Being a critical care intensivist, how did this journey from critical care and anesthesia move into the field of AI?
So, till 2019, I was not even aware about AI. What is AI? The word AI. My mentor, I met him in Dubai. So I was working there, and he came for a conference, and he told me, "Would you have a coffee?" I went there after my night shift. I still remember, and then we talked for 10-15 minutes AI and the future of healthcare and all these things, and that got me inspired. And then I started learning about it, and then COVID came and online education picked up, and then I started learning. After coming back to India in 2021, I tried to restart my pain clinic. So basically, I'm an anesthesia, critical care, and pain management specialist. I thought I'll run my pain clinic on the sides and keep doing the AI work. But
I think we are having some network issues with Dr. Avneesh. While we wait for Dr. Avneesh to sort of rejoin, I would like to bring Dr. Sridhar in again. Dr. Sridhar, if today someone is a student, medical student, or sort of looking to get into tech or health tech, what are the 3 things that he or she should be doing?
see, first of all, when you say health tech, we have to remember that generally we are only looking at from the doctor's perspective. But when you go into health tech, the whole wide ocean of health comes into picture. Somebody may, for example, might say, I'm only going to create a solution for the sterilization unit. Right? So how many of us know about the detailed workflow of the sterilization unit? Right?
Right.
For example, I worked for the kiosk which was doing the work of the hospital receptionist, the clinic's receptionist. How many of us know what our receptionist does it in the hospital? So we have to become a bit more curious about various people. See, somewhere doctors, we also put ourselves on a very high pedestal in India. But healthcare doesn't run only because of doctors. So start understanding what other people in the hospital do. The hospital has so many technicians. The hospital also has a finance department, HR department, so many other departments. So start understanding those and start looking at workflows, the process from beginning to end. What are all those steps?
So I think in short, be curious and go in depth into whatever you're trying to
Understand the systems and processes.
Right.
See, whether you know the technicalities of AI or not is not the primary thing. Your expertise is the healthcare expertise.
Right.
Right? There would be some developer, or I never coded. Right? There were others who were doing that. But the decision from the healthcare perspective is always mine.
Right. So I think the domain expertise backed with curiosity and going in depth, I think that's a very important take home message for someone who is beginning as such. Dr. Avneesh, thank you for coming back.
Sorry about that. I had a network glitch, so I switched it. So
Yeah, go ahead.
So I was saying that I completely agree with Dr. Sridhar that you need to be curious and be willing to learn. And I think you should also not have that fear of change, which is a big thing, and that sunken cost effect and that status quo bias that comes into our brain as doctors, because we have spent so much time reading a subject that we are too much afraid that what will happen if we don't practice this. But believe me, my knowledge of medicine, my whatever I learned, whatever I practiced, is useful each and every day right now also whenever I'm teaching other medical professionals. So whatever you are learning, whatever skills you are gaining down the line as a medical professional, they are absolutely very, very important. So if you are doing MBBS, please finish MBBS. If you are willing for PG, please do your PG, and nothing is going away. This AI is here to stay. You can always brush yourself up in technology, and then you can take a shift also if you want, just like me and Dr. Sridhar took. It's totally possible.
Right, but at any point of time, did sort of not just the effort factor come in, but oh my gosh, my parents have paid so much money, they've made me study so much, I have invested and paid so much. What happens if this doesn't work out?
Yes. So one of the things I'm very lucky with is my family support. My dad is a dermatologist, and in fact, he didn't want me to be a doctor, but I fought and I said I want to be a doctor, and then because I think he realized that I had a mindset for computers and technology long back in my 11th class. I had computers as an optional subject, but I didn't realize it that time. So you need family support, and you need to convince them with whatever you're doing, and you should be good at that. If you are going into technology, then you should deep dive and immerse yourself into it and not just do it for a hobby. And then people start realizing that this guy is enjoying it, and he's doing it nicely, though. So then they keep supporting. Dar sabko lagta hai. You feel afraid. It's not easy leaving everything, and then the financial kind of the thing also. So you have to assess your situation, your responsibilities, everything, and then make the jump. So I had very favorable situation. With a disclaimer, I will say that, but you should make it favorable and then do the shift if you want to.
Would you recommend quitting your clinical practice cold turkey, or would you recommend dabbling, and once it starts, you start becoming good at it, then descaling your clinical practice?
I would not recommend this because it will totally depend on personal situation. I was burnt out in COVID, so my situation was totally different. I couldn't go to hospital the next day, and the thing that I had to lean on was my knowledge of technology and my passion for learning about it. So if you face such a situation like burnout, then I would say that please don't continue something which you're not liking, um, even if it means leaving it the next day. But if you can do it and find something which goes along with your medical profession, I would always prefer doing both together, because you get a perspective of the real world when you're practicing medicine, and that's totally valuable. So as a clinician working in technology, preferable would be if you can do both. And if you're burnt out, then please take a call and switch sides. Don't let your health get harmed.
Right.
We have seen.
Go ahead.
We have seen of late an uptick in the number of AI-based theses, especially in my line because it's very visual. There are a lot of AI-based theses that are going on in my field, but I think that's applicable to a lot of other fields. Would you recommend this as a way of getting yourself into AI from the first year of your post-graduation?
So I think Dr. Jaideep is here. He's a medical educator. He has more experience than me teaching medical students. So I would like to know his perspective also, and then maybe I will add on something. Dr. Jaideep?
Sure, Avneesh. I think, see, this is today, right? So I'm just, all of you are just starting off their careers. And in the next 5 years, in the next 10 years, things will be a lot more different. So I can say that, like Dr. Sridhar and me, we come from an different era. And if I map the evolution and the development of the technology as a graph, it is only growing exponentially. And I would say, don't prepare for tomorrow, prepare for day after tomorrow, right? Because things will be different. There will be an MD in digital health. There will be an MD in healthcare. There will be proper jobs which are only specific, where a person should be knowing medicine and technology in equal proportion. So all these things are coming up, right? So leaving medicine totally is not at all helpful. I can vouch for that because I left even academic medicine a long time back, and I do feel that there is a gap in terms of knowledge and the current situation, and that gap is not going to help you in either ways, right? So please don't leave medicine totally unless you say that I'm not coming back, I'm going to burn the bridges. That's a different story, but
So
it's
just
really
to
not
summarize
going to be.
what you're saying, and we had this very interesting conversation when you came to Bangalore last time, is that if you like AI, that's not the reason to leave medicine. You can still do both because the medical knowledge there acts as a good expertise in keeping up with current affairs in medicine as such. But like Dr. Avneesh said, and you're also making a point, if you're disliking medicine for whatever reason, be it burnout or other logistical or personal issues, that should be the only factor, not because you like AI. Would that be a good way to put it across?
If you're having issues with your career in medicine, I think one, you have to really make a choice, right? So is it just an escape mechanism? Don't do it for the sake of like, hey, I can't do this, so I want to do this, right? So there are other mechanisms to cope with it. Maybe take a break, maybe change your boss. Right? So there are these issues which can be there, uh, but you need commitment. So if you get burnt out in medicine, you will get burnt out in AI. I've been in the industry, and it's not at all pleasant,
Yeah,
right?
so let's
It's not at
let's
all
hear
pleasant. So
let's
we
hear
need
your
to
journey.
be balancing that.
Let's hear your journey. You said you sort of quit academic medicine about a decade back. How has your journey been in the space of health tech and AI? What prompted you to make that shift?
Right. So I had the opportunity studying in the CMC Ludhiana of actually being digitally active, right? So right through MBBS, then through PG, trying to bring in, in those days it was like computer, something to do with computers, and now we call it digital. To what do you call? I think I need to change my mic. Just a second.
So till Dr. Jaideep does that to answer Dr. Meka's question, I think choosing a AI thesis topic is a good way to start dabbling into AI. But then you also need a mentor who is sort of updating themselves in that field.
Can you guys?
Very good. Yeah, but it's a good way.
Hello.
Yeah, we can hear you, Dr. Jaideep.
So what I have seen with my juniors is that they do collaborate with the industry. So it's
Yes.
not only the onus on the head of department or their guide or the junior faculty to assist with them. We do have, I was working in KMC Manipal recently, and we had around 3 students who were doing their thesis with AI.
Yes.
And they
So-
collaborated with the MIT college.
Yes.
But in other places, they do collaborate with engineering colleges, and that works two ways.
Yes. So someone sometime told me that AI is a team sport. It's not like a bad lawn tennis. It's like basketball. So you need multiple players, and when your student chooses AI thesis topic, you as a mentor, in fact, should help them collaborate with their engineering peers also, so that they can build some good project and get a true picture of AI, and not just that just publishing a paper in AI would make them an AI expert. So that is really responsibility of the guide.
Right, Dr. Jaideep, if you could continue with regard to
Yeah.
your
So
GP.
yes. I think there was a slow development, continuous development in bringing digital health, in bringing he- technology in education, and that sort of then evolved into the interest in AI. And at some point, you hit the ceiling, and there's only something you can do in a medical college with AI. So I did take the leap, like Sridhar did many years back, but I took it very late, and it requires a lot of support from people around you. And I landed into the industry. I worked for 2 years in a data annotation company, which was basically my job was to train the people who are going to train the people who are going to train the algorithms, right? So that kind of a work. I worked for with a startup in US, and I also worked with an NGO leading digital health and AI, right? So there are that kind of a continuity. Like I'm a professor, then I'm going to be there in one place. That doesn't happen once you jump out totally. So there will be a lot of jumps. Right now, freelancing and consulting, and yes, it becomes a risky journey, right? So at some point, and that is something which you don't come prepared for when you're in a medical career. So these are tumultuous times. We do have to understand that, and things will sort of stabilize in few years' time. But these are times of change. So as young graduates and young postgraduates, it is good to be aware and keep the options open rather than take hard decisions.
Right. So I'm
My
going to
my
put
my.
I'm going to put three of you on the spot here right now and ask that if today a MBBS graduate is coming out and he says, I'm not going to get into the rat race of NEET PG, I'm going to do something in health tech or AI. On a scale of 1 to 10, how risky is this career choice?
Zero. Let me go first. So there are people who are actually doing that. They join. I have had students previously as well who, in the first year, were very clear they are not going to pursue medicine as a career. They're going to use MBBS as a leverage, as a stepping stone for maybe technology, maybe IAS or whatever, business. But MBBS as a very versatile, in the sense, very multi-talented kind of a thing, to step ahead, and as a launch pad. So the risk is zero in that ways. I
Right.
would say it is more risky to be going into 100% clinical, but
So
I'll hold on to that.
very, very, very difficult to be very sure about these things in the era of singularity which we are reaching. So everything is uncertain. Like you stay in medicine, that is also uncertain. So what you are training for, will you be able to do that tomorrow? Is a big question, right? So that is also risk. And there are very few technologies or very few moments of history where you were so sure that this technology is definitely going to be impactful all across the world, and when AI is that sort of a technology. So if you are working in AI, definitely you are going with the flow of the world, and where the technology is going. So in that sense, risk decreases. But then again, risk is both sides. You have to choose your risk. One risk you will definitely have to take, and the best is, as Dr. Jaideep said, do both. If you can, don't leave medicine. That would be the best combination if you can.
Dr. Sridhar, I'm coming to you with a little more prudent question. Is that with so much democratization of AI in tech, this is a question from Dr. Binu Joy, who has been a senior radiologist and has made this shift into the field of health tech and startups as such, and are catering to the healthcare needs in Southeast Asian countries, and has also been in admin. So his question is it prudent to get into careers only in AI, or encourage more domain folks to learn how to gainfully leverage tech? I mean, yes, we are all talking about AI, but do you think being involved in health tech itself, like how you discussed about the various verticals in a hospital, that itself is a space where doctors can lend their expertise in.
See, you have to deep down, each one of you have to look into yourself. The point is, you said risk. Risk of what? Risk of burnout, risk of not making money, risk of boredom. That I'm going to the same clinic every day, giving the same prescriptions every day. You might be making money, but still not satisfied. We doctors are a strange organism. We get money also, we are not satisfied because we are intellectuals. We get high intellectual work, we are not satisfied, we are not making enough money. Right? So you have to deep down look at what makes you happy. And let me tell you, I'm not just an AI or a tech guy. I am a writer, I'm an actor, I've done a stand-up comedy. Okay, I sing songs, I do mimicry, I do a lot of other things. Whatever I like, as long as it pays me money, makes me happy, I will do it.
So I would say here that you're the alter doctor. So that was a platform we started for doctors to showcase their creative hobbies and passion. So we always say, at a risk of personal bias and promotion, you're the alter doctor.
Yeah, you start as a hobby. I was tinkering in tech, like just Avneesh and Jaideep were saying. You start tinkering somewhere, and then you become a very good tinkerer, and suddenly you say, hey, maybe I should do this full time. So when I went to my first interview with one of the tech companies, they said, how come you got such a big hobby list? I said, yeah, I got many hobbies, but this one is making me money, so I'm doing this. Otherwise, this was also my hobby.
Right.
So don't get into AI and tech for making money. Go into it because you like it, because you enjoy it. Otherwise, they're also going to suffer. Your initial job, you may get a package, but then you're going to suffer. And then you're going to say, oh, I was better off there. Asman se gira khajur pe latka. Right? And then see, I made it worse. Then I became an entrepreneur on top of that. Right? I was having a happy, good salary. And then I said, I will become entrepreneur. Now I'm sometimes I wonder whether the thela wala outside is making more money than me. So you have to discover what gives you internal joy and pleasure.
Right. Dr. Avneesh, taking up on the point of Dr. Sridhar here, would you advise students to focus only on AI or on different aspects of tech, health informatics? We have not really touched upon that aspect as well. So do you think that in sort of career growth and career prospects, even other health tech fields have a scope, or is it only in AI?
So what I would say might not sound practical, but I would say that try to learn anything and everything under the sun if you can and it interests you. I think the future is not going to be of too much specialists. You need to have some kind of specialization, okay, that matters, but then you should have general skills all around the board. You should be able to speak well, you should be able to communicate well, you should be able to negotiate well, you should have some knowledge of law. Means everything is important, and all these things are not taught in our medical curriculum. The knowledge of business, I had to go and do MBA from BITS Pilani to get knowledge about business, and ultimately that led me to this path of technology and AI. I told you in 2019 I didn't know anything about AI, and it's not so far back. Like, Dr. Sridhar has been doing it for 10, 20 years. Dr. Jaideep has been doing it for more than a decade. So, see, you should learn everything, have a holistic perspective. Don't just stick to your medicine knowledge. That is definitely going to be helpful for you, but that's not going to be enough. Whether it's AI, whether it's any other technology, whether it is hospital information system, whether it is information technology as a whole, just try to keep learning and getting bits and pieces from wherever you can. Sit with your hospital CIO, for example, Chief Information Officer, go and have a cup of coffee with them. And try to understand what they're doing, how it happens. I think that will make you a better doctor, no?
I think it's very important to even try to understand how many medical students at this point of time would know that a hospital has a chief information officer. I think that in itself would be a learning to try to find out what would that role be. Dr. Jaideep, I have a question coming in from someone who is from the batch of 2018 who is just finishing their rural service, and their question is very straightforward, that they don't want to continue clinical medicine anymore. They are looking at being part of medical affairs in the pharma sector. They are looking at being part of health informatics. They're looking at, again, everyone has just a vague idea of AI in medicine. How should they go about choosing which of these three pathways they should take? Are there any specific institutes which offer shadow experience, or how do they do it?
So I think before studying institutes and other systems external, you need to study yourself, right? So and I had great friends and mentors who helped me in that journey to discover myself, right? And I'll share links later on. But one of the things which I did was the Strength Finders exercise. You have to pay some money and you will get to know what you are actually capable of. So and that is very important, right? So these are just vague ideas like I'll go to pharma. I had all those ideas, right? And one of my ideas was to become an entrepreneur, and I came and I met Jagdish Chaturvedi in Bangalore, and I said no, I'll join you, and I became a mentor with their company, right? But then there's something more, and my core of being an educator, somebody who will learn and somebody who wants to teach, that still remains my strongest element. And that you need to know, and that only you need to exploit. So don't think of something fancy just for the sake of fancy. I'm not calling what you are dreaming as fancy. Do research on yourself, look inward, right? So magnifying glass is good, but mirror is better.
What courses do you think a doctor can now take to learn about AI?
Okay, so multiple courses are there. Avneesh is smiling because we are involved in a lot of these things.
No, no.
Personally,
So
so
I
let me
think at the
talk about.
outset, at the outset, we'll just put in the disclaimer. We are not here to promote any of the courses which you people are personally part of. It's part of sharing the general information. So feel free.
Yeah.
Yeah. So feel free to go ahead with it. Yeah.
Yeah,
Dr.
so we will
Avneesh.
not tell that. So we will not tell that.
No. You
They
have
are
to. You're free to tell
fully
it. You're free to.
available, and
Yeah.
So
You're
the
free to.
smile is because of the confusion that is going on out there, and as confused as the takers of courses are the providers of courses. And then Dr. Jaideep, I think he will tell more.
So like hold on to your horses. So I would say start with Coursera. This has been my standard advice to everyone. Invest if possible 7,999 on Coursera, and they are not sponsoring us, but Coursera is a good place to start with a basic course and go on to an advanced course, and you will get a certificate which you can display on your LinkedIn, which will make you job worthy as well, right? That is one. You want to spend a lot of money, please take up the courses which cost 1.5 2 lakh rupees in dollars. You want to spend a lot of time, apply for the long term programs in universities in India or abroad, and that balance you need to make, how deep you, what you want to invest. So time, money and effort, between these three you have to balance what you want to invest. We will share link of free courses later on, but it's up to you. The balance is there. So start with Coursera is my advice in any case. Yeah, Sridhar.
Yeah, this has been an internal debate which I've been having for a long time, and my answers may change the next time we meet. Okay, nothing I say, I always question myself also. Okay, so I will say one thing very simple for all your students who are listening in. Why do you want to learn AI, and what exactly do you mean by I want to learn AI? For example, if you want to learn how to use Chat GPT, Notebook LM, you just tinker with the tool, you will learn it. Okay, that's how we learned it. So see a few YouTube things, join a course like this, a session like this, or just meet amongst friends, you learn from each other. Today itself, while watching your one of your presenters, I learned a few tools. Okay, so first start tinkering with these tools. Most of you are going to be users of AI tools. You're not going to make an AI tool. That's a whole different ball game. Okay, user versus maker. Okay, so figure out what exactly you're trying to achieve here. You're going to be a user, then best is use it, no, on a daily basis. What is more easier than typing in a chat GPT prompt, right? And ask it. It itself will teach you. How do I give you a better prompt? It will tell you. It is like Bhishma telling how to kill me. And that's why it tells itself, right? So start with that. Figure out 1 month you sit on one tool and keep using it, because every day you get to hear of one new tool has come for that, and it is a better tool and a better tool. So don't do that. Stick to one tool. learn it, and use it for your clinical purposes. Now coming to why do I want to, maybe if I want a job, I need to learn AI. Now again, your strength is you are a doctor. That is your strength. You, by doing a 6-month AI course, you're not becoming an AI champion. There are exceptions of doctors who do PhD in AI, that's a whole different thing. That is also possible. But saying that I will do an AI course, a short-term course, yeah, but it will certainly give you a flavor of what AI is. You'll get a bit more deeper. Like I did a few courses about, I showed you, I did SQL and Visual Basic and all that, but I never professionally coded. When you join a software company, your knowledge of these small courses that will do will give you some idea of how I can envision an AI solution. Also, it helps you talk to the other person. When a techie talks some jargon, LLM, at least you know what he's saying. You yourself will be not writing a single line of code because they have got their own AI specialists. But you are supposed to work with them and tell them this is what you want. Finally, you will be the boss. You are the final stop who will decide whether this is a good health AI tool or not. That is your position you all have to reach when you go into an AI company. When you say they want to kill somebody, they have to stop development. That's it. Right? So that is your position of authority.
Right. I think that's a very, very valuable piece of advice that as doctors and end users, our expertise on whether this AI tool is appropriate or not is the skill that we need to develop. Dr. Avneesh, coming to you, if there is someone who is sort of looking to making AI tools, to being hardcore into AI, so to speak, into the depths of AI, let's say I want to get into radiomics and image analysis. I want to learn about big data and data analysis. Do you know any resources, or what would your suggestion be if someone wants to get completely into data science, data management?
So excellent. I was coming to this. I was thinking of coming to this after Dr. Sridhar, that although most of you will be end users of AI or will choose to be end users of AI, but then some of you will definitely also go into the developer role and you will have a developer hat and build something with a team, of course, because I told you AI is a team sport. But you need to then dive deeper into those topics like coding. You should know how to code, and it's not that doctors cannot code. I know some doctors who know 23 coding languages. A pathologist working in a tier 2 town of India is knowing 23 coding languages. He's having his own private server, and he is also doing pathology. So it's totally possible. So I think if you have made this as your goal, or that is what I mentioned in the chat, is goal-based learning. Once you've decided your goal is that, then you work towards that, map out your resources. Go to LinkedIn, please make a LinkedIn profile and start looking for companies that are working in that area. The best way to get to learn something is to work with people who are doing it. And now there are companies in India also who are acting like marketplaces for these, for example, radiomics companies. I just had a mentee who just joined a company 2 days back, and she was always asking me, "Sir, how do I learn AI? How do I enter into AI?" And now she got her answer. She has joined the company, and now she will be exposed to so many AI developments happening on a daily basis, and she will build a portfolio with time of working with radiomics companies. And that is how you make that shift, because people will always, first of all, see you as a doctor. Even if you are not doing medicine, people will see that you are a doctor because you have a medical degree. So you need to make that shift of perception through changing your image, and it happens gradually. It takes time, it takes some genuine work. You have to build portfolio, not just a portfolio of certificates, but a portfolio of projects. And that is what you should be looking at this point of time when you are trying to make that transition. And once you are into that track, you will find, like, once the train enters the track, it will find its way. That is how it happens.
I think LinkedIn is a big resource now. I think you made a very fantastic point. I have one ophthalmology junior who, to get into the field of oculomics, just looked in LinkedIn, looked at companies which have been working in, messaged, and then got the opportunity to visit some of them to understand. So I think the image perception and image change will come when you go and work. And I think as Indians, we feel shy sometimes to ask, but I think with LinkedIn there, it's an open space and people are ready to give you opportunities. May not be paid, but definitely opportunities to go and explore.
And most of these things don't get advertised on job platforms. They get curated for you. That is important. Yeah.
Sorry, Avneesh, to interrupt. So, rightly,
Yeah, no,
as
no,
Avneesh said, there are some people who might want to drill deeper. Like this guy who's digital pathology, he's a doctor and is doing. I did a lot of work with SharePoint. So somewhere when you finally decide, okay, this is my career path, then go deeper, as deep as you can, and let your curiosity run. Right? Like I become a founder now. And when you're a founder, you have to do everything. So you may end up doing a PhD in AI. So if your inner self tells you that, please go ahead. Doctors can study everything on the planet, I believe. Right? We have been studying such thick books. Now, what I'm going to show you on screen now, can you share my screen? I'm
You,
showing
you,
some.
you can do it. No
Yeah.
problem.
So what you're seeing on my screen is my LinkedIn profile. I have a few students who have been teaching in a Indian health management research. Right. I go and teach them healthcare related AI. I also go as an examiner. So what I've been telling everybody over there is, you see that thing which is scrolling up and down over there. That is a prototype made using vibe coding. So in case you have ideas related to healthcare, even if you don't know much about AI, open a tool like Google AI Studio, give it a prompt that I want a tool. Let us say you want to talk something about TB. So give it a prompt and make a tool and keep giving those prompts till it gets roughly to your idea, and then put it out there. A living working portfolio is the best thing you do. Don't have a CV, have a working stuff and showcase it to the world. See, now this guy, then I also added this and showed it to so many health tech guys, and some of them they are attracting some of these guys now. See, this is
I,
one dentist who has made a dento verse from tool. I'll enlarge it for your sake. So this is a prototype. Okay, this is only because they were saying, how do I get a job? I said, put out your ideas out there as working portfolio. So this is one prototype. Somebody was an Ayurveda doctor, they also made. So you can go on making these things. Right? This is Prana Health. This is another prototype. Like this, see, cath lab related prototype. All these were made in 24 hours. Not even, maybe lesser. So if you have ideas, see them. Your strength is your medical ideas. Put that with AI and quickly build something. So maybe that itself could become a product in future if you're too lucky, or at least somebody will know that you're thinking in those lines. That is what the people are looking for. Do I have, so there are dime a dozen medical doctors out there, millions. But who is that medical doctor who is thinking in technology and AI terms, who's already ideating? That is what people are looking for.
Right. And Dr. Jaideep, coming to you, I think a very fantastic point you said about putting prototypes out there. But I want to ask you one question. What if I put out a prototype of mine out in the social media and someone steals it? Do I have IP over it?
Sorry, I didn't get the prototype of.
No, I have an idea. I put the prototype out on my LinkedIn profile to attract people to hire me or to notice me, but someone else steals the idea. How do I protect my idea with IP or
Patent
intellectual
it,
property?
simple as that. So I think this is again, we need to be very careful when we are getting into the industry with ideas as entrepreneurs. So you're like any other entrepreneur, right? So you really need to protect your idea and block the IP behind patent, right? So get that. That is like simple because people will steal. So and that happens everywhere, right? So even whether it's academics or in industry. But I just wanted to add one more thing to the previous discussion before, you know, like in terms of career profiles. So there are a lot of careers available in the AI industry currently, right? So like I was like data annotation is a very good career option which is there. Consulting is a very good option. All these fields where I have jumped and I have done something AI in a specific field, right? And with DPDP Act coming up in the next year, okay, there will be designated data protection officers, consent managers. So there are these designated, uh, posts which are going to come out, like Chief Medical AI Officer, right? So these are already there. Look up LinkedIn, find out what is the requirement for that, what is the training which is there for that, and do it and get into it. Of course, few people get out and build products and do the coding, that's also great. So many of my students have done that. I've shared yesterday also some of the links for those people, and there's a huge amount of availability, of opportunity right now. Yeah.
Dr. Avneesh, you wanted to show the career spectrum slide? Dr.
Yeah.
Sridhar,
So,
while Dr.
I'll
Avneesh
just,
shows it, yesterday we had Dr. Vishal from St. John's Medical College and Dr. Rajavardhan from Manipal Sajapur, one of whom used vibe coding to develop a migraine app, pediatric milestones development app, and Dr. Rajavardhan, while the program was going on, used Gemini to develop how to manage shock in ICU, an app. So yes, doctors are doing it, and I think it's very important that everyone should not be overwhelmed, and you don't really need to know coding, just an idea and having a good goal is important. Dr. Avneesh?
Yeah, so can you see my screen?
Yeah, we can.
Yeah, so this is the kind of what we are discussing from so long, is that you are going to be in one of the three roles. Like you are going to be at one end of the spectrum, which is consumer, or you are going to develop or somewhere in between, which Dr. Jaideep mentioned. These different roles are going to come up, like a chief DPDP officer, chief consent officer. All those things are going to be there in between. So a lot of roles are going to open up. The level of technical depth and knowledge that you have to go deep into will depend on your role. So this is like a core. If you want to be a developer, then you have to learn about all these things in too much detail. And if you just want to delve on the top as consumer, then you need to know only not too much in deep, but only the basic things. So these are some very nice papers. I'll share the links later on so that we can share with the participants to get more clarity.
Right. I think very important point Dr. Jaideep made, data annotation, DPDP officer, trying to look at developing products, being a subject matter or a domain expert to develop products. I think these are all the roles which are there. Fortunate to have Dr. Anthony Robert. He's the president of the St. John's Medical College Alumni Association and also a pediatric surgeon. While we are doing, he was asking ChatGPT some of the questions that we were discussing. Dr. Robert, if you could share, what did you ask ChatGPT and what was the answer it gave?
Hi, good evening, everyone. First of all, a big note of gratitude to all the panelists and our own Nitin and Mihika, apart from the others. I've been listening on and off. I was bowled over by Nitin. In 3 minutes on a hockey field, he showed me what a notebook could do. So I've been curious. But I'm from the generation where I think AI is, artificial. I'm leaving out the word intelligence. Yeah. So the question I asked on this group, on this chat, was that I get irritated. Even this morning, I was irritated because I spent 45 minutes with a software engineer who was using his own AI intelligence. So I just asked ChatGPT now. I said, why am I getting irritated when a patient says I used AI? And the answer just blew me away. I could sit with a clinical psychologist counselor for an hour and get the same gyan which ChatGPT gave it to me in such an empathetic form, broke it down, also told me where I am getting angry and how I can shift my understanding, shift the patient's understanding. Then it said, do you want me to give you one-liners you could use your patient next time? I said yes, and it's actually so beautiful, so beautiful. My psychiatry HOD couldn't have done a better job. So hats off to this science. And but it's a real thing, especially if I talk to my colleagues. We are bang in the clinical field, and we've been there for many years. So I think a lot of the resistance will come from there, and that's a confession that I'm making. It's easy either when you're a youngster or when you're like the seniors who made the shift very early. But there is a natural level of suspicion which triggers, I think, a lot of us. Which triggers a lot of us. We look at it with suspicion. Having said that, one last line. Whenever I try to read on AI or log into a talk on one of those the courses, it's been a lot of lecturing which comes. And after a little while, it flies over. I think this level of friendly banter, which all of you showed yesterday and today, I think that will break down walls of AI for seniors. So, Nitin, like you did this for young rural doctors, I think you should do a similar one for mid-career and senior level clinicians who are actually the end user, who probably will oppose it or can use it better. Thank you. And a big shout out to all of you. And I'm sure the recording is going to go viral because I will make sure it goes to all of my contemporaries.
I don't know if he will make it still go because I was about to refer to him as the old pediatric surgeon. But
I take back every word.
right. I'm going to end this with one last question. Dr. Robert, I would want you to stay. I want to bring George on stage, Dr. Josephine on stage as well. Let's crystal ball and let's keep this moment in history. One big impact you think AI is going to make in clinical health tech, medical education sector in the next 5 years and in the next 15 years? How do you foresee crystal ball gazing? Who wants to go first? George, we'll go with you as the youngest. You're on mute, George.
Audio.
My bad. I feel like one way where it is really going to help out is in just, bringing down the amount of clerical work that we have to do as clinicians. Like coming, right out of St. John's, where the number of files we fill in on a daily basis is just overwhelming and it takes a lot of time away from actual clinical work. So that is one. And the other is just, basic history taking and, giving a filter to the patient as to what level of care they actually need, taking out some parts of triage away and freeing up more and more medical resources to be used more effectively.
Meika?
I think the common misconception among doctors is that, especially in visual fields, radiology, path, the mat, is that AI will replace doctors. I don't think AI will replace doctors. I think the doctors who use AI will replace the ones who don't.
Right, but where do you think in dermatology AI is going to change? What's your crystal ball?
Rapid screening in the peripheries. This is not so much of a problem that we see in India, but in the US, if you want to see a dermatologist, you can wait up to 6 to 8 months and you might be sitting with a melanoma. Their screening tools on those have become really, really good. Where I think we need to develop is images based on skin of color. That is still lacking. I think AIMS has some projects going on in that direction, but I think that's somewhere that we need to work, and that's true for all tech, all healthcare in skin of color, not just AI.
Dr. Josephine?
Hi, Nitin. Hi. So being in public health, I think I've always been fascinated by how AI is going to be used. So I'm already using it in screening for certain conditions. So when we look at public health, like I have a volume of around 200 to 250 patients coming in for NCD screenings in a matter of 4 hours. Okay, and I know by protocol I should be screening all those with uncontrolled DM for TB, which I was never able to do before, but now we have devices where I just get an X-ray and the AI screens. So for like every 100 X-rays that are taken, I get a rate of around 7 X-rays which are abnormal. We've even diagnosed lung cancers for that. So in public health, when for a population that's as large as ours, so I am fascinated with the use of AI in screening because I'm able to take it to a lot of people. I don't know if any government institutions are actually increasing the hiring of doctors and nurses. Where I work, it hasn't happened in many, many years. But having AI reduces the workload, not to individual doctors per se, but services I can take out to people more quickly. So I think AI is definitely a boon as long as we know how to handle it and how to use it.
Right. Dr. Avneesh? You're on mute. I think you're on mute.
Yeah, so I totally agree with all these things, and some broad themes which I feel moving forward is that we'll finally be able to make the shift from curative, reactive kind of a healthcare to a proactive, preventive healthcare. We have been talking about it, but I think now we'll be seeing the impact of all those changes happening. Second is information is going to get democratized. There's no more going to be siloing of information. We are not going to be the knowledge providers. We are going to be the knowledge mentors, so to say, for patients. the way of learning, teaching, and the way of consuming information and doing research, doing peer review, and all those things will have to change. It's going to collapse, I would say, if I can, on this forum, because the way the research is exploding now because of AI. We had a review of, like, we used to have around 1,000 papers last year, now 3,000. Now every year it is becoming exponential, 3 times. So next year 9,000 papers to review, then 18,000 papers to review. So this is not sustainable. So we need to find some kind of agentic AI tools, maybe build some tools to be able to take this onslaught of information and convert it into wisdom. So I think these things are important moving ahead.
I just want to bring Josephine back into this because she talked about research and publication. What is your role? What is your sort of own personal beliefs or opinions with regard to AI reviewers? Do you think they do a good job? Do you think it's something that when, as a author, you're sending in papers to a publication? I now hear that AI interviewers are there for jobs, but do you feel that you would be okay with the rejection coming in, or do you feel no, if it had gone to a human, the rejection would not have happened?
Actually, a lot of journals that send me papers for reviewing, they do have a clause that we don't use AI to review the papers. Okay, and I wouldn't say I'm old school, but I do think practically papers are better reviewed manually even now, because when we are reviewing papers, we need to be able to identify if there's an inherent bias in these AI tools. So unless we have something that is trained and has a good algorithm for reviewing, as of now, from what I know, I don't think it's there. So I would say no. And there are journals that specify that we don't use AI for reviewing.
Right, but I think of late, by the sheer volume, journals are possibly developing their own AI tools to review as such. While it may prevent reviewers from using AI tools, I think they themselves will be developing their own AI tools to review papers as such. But I think it's an evolving field. We do know that LLMs are being used as even in judiciaries as such. There is a lot of debate on whether it should be used. I don't know if you came across where a judge read a citation and it also read out, "Can I frame this for you in a better way?" Took it word for word. So I think these are tricky situations. Dr. Sridhar, your crystal ball gaze into the next 5 years and 15 years?
Next 5 years, what does my crystal ball say? See, I have been telling Avneesh and others that I've stopped crystal ball gazing when it comes to AI. It's changing too fast. Point number one. But point number two, I'll take a guess and I'll hazard and tell you something. First of all, will it replace doctors? We don't know. I will neither say yes, neither will I say no. But for the sake of society, we need many more hands. We simply don't, at least in India, we simply don't have enough hands. So if an AI assistant can come in, sure be it, think not only about us, think about society at large. But what is also going to happen is human beings don't change. What is the human being even today doing? I will consult Gemini, I will consult ChatGPT. Gemini says no surgery required, so I will say Gemini is better for me today. So you're going to get more problems. What is going to happen? My crystal ball says many of our current diseases will slowly diminish. We will eradicate a few. But what will happen is a whole new set of problems will come. Sociological problems, not just I'm talking about the healthcare diseases and all that, but problems like job loss. What will it lead to? More psychiatric problems. Whether your AI psychiatrist will treat that or God knows who will treat it. But if there's going to be rampant job loss within the next 5 years, because AI itself is going to take away jobs. I'm worried about Bangalore real estate. I own a few houses. Who will go for rent? Half of Bangalore will go unemployed. Then unemployment leads to what? Civic unrest. Right? There's already talk going on about all these things. Right? So AI is going to solve a lot of problems, but human beings being human beings, we find a way to hit ourselves on the foot. So we are going to use AI. Already it's being used in wars. We have heard of Venezuela. We're hearing about so many things. Right? Do you think people are not using it? And there are always bad actors. There's always a bad guy trying to figure out how do I make a bio weapon. Right? So AI is going to help that guy also. So it is a double-edged, very powerful weapon. It's better that all of us, the good guys, learn AI faster to fight those bad guys.
Yeah, I think that's a very, very important advice in the times that we are living in, and with whatever is coming on the Twitter.
One more point to Jaideep and all who are giving career advice. Just I will say one thing. When those of you who are going to start, aim for the top, man. Become an AI product developer and entrepreneur. Rule the world. Don't say I want to do a job and be under some techie somewhere.
Absolutely.
You be the rulers.
Absolutely.
Yeah. Dr. Jaideep, your crystal ball prediction?
Yeah, I think yes. I'll continue with what Sridhar is saying. We do not know exactly what kind of technology will exist after 5 years and after 15 years, right? So in that situation, in the journey, I can tell some things. There will be a bloodbath of people losing jobs, even in the healthcare industry, right? So I used to be this advocate of saying that doctors will lose jobs to those doctors with AI. No, it's not the case. There will be en masse, big block of jobs which will be lost, right? I probably the last people would be like specialist surgeries, but keep that aside. So the ecosystem will change, right? Finance systems will change. Public policy systems will change. How people communicate will change. I was talking to a person on the sidelines of an AI in journalist, era, and they're saying how people consume information has changed. The entire psychology, the doom scrolling concept, there are entire generations which are growing on that kind of a mindset, and we need to sort of, all of us really need to do some kind of a crystal ball gazing and start preparing our own sort of fields. We need to safeguard and we need to do that. So this is not the, this is just very small part of AI that we are dealing with today. It will be a million or a billion times better or different in the coming days. It will not be in a straight line. It will be exponential to exponential.
Very
I'm not
interesting.
scaring.
Yeah, but very interesting comment coming in on YouTube. And that is possibly a crystal ball, which I may agree with, which says brain-computer interface will become commonplace in 2 to 3 years. And I think with Neuralink and everything coming, I think we would start seeing, I think that's science fantasy at this point of time, but possibly reality in the next 5 to 10 years. I would also say that sort of what we have discussed, I think it's going to come to a time when medical education is going to become personalized. The lack of good teachers is something that is not going to be felt anymore. All of us are passionately working towards NotebookLM taking its place in personalized education at this point of time. I think and hope that should be the current and the future. And I would say it would get to a point where knowing about AI becomes commonplace, but I think how do you use it in the right way and how do you judge what is good and what is not so good is going to be the key differentiating factor. We'll come to Dr. Annie Robert for the closing words. And to answer the last question, any opinions on AI apocalypse? Jeffrey Hinton always talks about it. Dr. Robert, do you think, you're a big fan of the movie Matrix? So do you think the AI apocalypse is going to happen? We are all in the world of Matrix. And if you could sort of close this entire today webinar. You're on mute.
Thank you, Nitin. You took the words out of my mouth. 2 points I wanted to make. One was the crystal ball in a good way for the surgical disciplines. Definitely, it's going to up the game. It's going to up the training. And one is in the field of robotics. Of course, AI in robotics will definitely increase the quality and the accountability of surgeons. And the training also is going to be really exponentially far better. The surgeons have been an apprentice-based science. I think robotics will change that because it will accelerate learning at a tremendous pace. And also auditing of results of surgical patients and their complications. It's already being improved a lot by people using AI. I'm amazed at how many senior surgeons in the US have adapted this science. You used the word just now saying science fantasy. 20 years ago, The Matrix it looked like a fantasy movie. but you're seeing it in reality now. In my own lifetime, I can see it. There's one scene, I'm not going to bore you. There's one scene where Neo, the protagonist, is trying to, Trinity and him are on a rooftop. There's a new model helicopter, and she asks him, "Can you fly this?" And he radios back to source. That fellow loads a CD into the computer, and then it comes into his Neuralink, and he says, "Yes, now I can."
Trinity.
And I'm sure in medicine that will come one day, wherein it's not something I studied back in medical school. I don't know about this. One flip of a switch, and then it would just light up, and I'd say, "Oh yes, this is what it is." And I'm sure it's possible. So I'm on a very positive note. I want to close this.
Just very quickly adding to what Josephine said, I think in oncology there has been a lot of impact on AI. Screening has been phenomenal with AI, and now there are projects happening. Can one mammogram predict the risk for the next 5 years as such? And in the space of public health, it's very important. Let's not forget that Demis Hassabis won the Nobel Prize for building something phenomenal, where protein structures, to find it and to design drugs which used to take years, you can now design a drug using softwares. We talk about fashion show designers, but now you have designer drug softwares, and more importantly, you have AlphaFold, where you can identify the protein structure in a matter of months rather than days, and then you can say where can the drug dock, how much should the ATP binding site be, what, and more importantly, also predict the genomics as such. Avneesh says not months, in fact, in 2 days as such, and I think that's where AI is evolving as such. So I think, yes, let's end on a positive note. AI has made a lot of impact in healthcare. It has helped improve knowledge. It has helped improve many skills. But as with anything, we need to be careful with it. All over to you, Dr. Robert, to conclude on behalf of the St. John's Medical College Alumni Association, this 2-day workshop or a webinar on AI for the rural healthcare practitioner.
Yes, thank you, Nitin. I'm going to be very honest. When Nitin called me a few months ago and said, "I want to do this on AI," I thought I was just indulging his private fantasy. I thought there'll be not much of a scope. I don't think it's going to be relevant to our rural doctors. All those misgivings, I never confessed to him that time, but I must confess now. And I'm glad to be proved wrong, because if it can excite someone like me, and you can see the level of engagement on YouTube, and I'm sure that in the years to come, many youngsters who pass out will get into this. So thank you, Nitin and Mihika from my team, for putting this forward and having the gumption to pull it off, and for getting the best experts in the field, people who could just relate to each other and relate to all of us with the content and making it so interactive. So big thank you, and I'm sure we'll tap this cohort again for a different group of recipients. Yeah. Thank you very much. Thank you, Nitin. Back to you.
Thank you, Dr. Jaideep. Thank you, Dr. Jaideep and Avneesh. I think at very short notice, they came up and were and they're doing a lot of stuff, a lot of programs, and they very graciously agreed to do this pro bono and were agreed to lead the entire development of the program. Thanks to Dr. Sridhar, who has been sort of the real Durandar, as we would say, in the field of health tech and AI, being very, very passionate about it. And as always, George looking a little morose and tired, but being the very, very tech guy who helps us put up all this. Josephine from the batch of 2005 from St. John's Medical College, picking up that very, very tough topic of AI in research and publication, but delivering it in a very, very crisp way. And of course, my thanks to Mika for putting up with all the late night commitments and work that I was giving her, and building this entire program. Thank you all who has joined us. We are almost close to 60-70 people joining us through it. Dr. Sridhar wanted to have a word. Go ahead, sir.
Now, we are all available anytime anyone wants advice or wants to discuss something. So I put up my phone number in this private chat. You can share with them. Okay, absolutely. I'm sure Avneesh and Jaideep and everybody would be more than happy to help out.
Right. Okay. We would be bringing out a small PDF with the list of courses available and the contact numbers of the resource people, so that people who have not been able to join or seeing the recorded version will be able to reach out. We, of course, are planning, as we said, a small educational experiment with NotebookLM, development of apps, and I think all of you are going to be great resource people for that. Until next time, this is Dr. Nitin Yashas on behalf of the St. John's Medical Alumni Association saying thank you all so much for joining, and we hope you found this useful.